Today is not just a conference, it is a celebration of knowledge, leadership, innovation, inner creativity, and spirit of medicine. On behalf of IMA Maharashtra Junior Doctors Network and Medical Students Network, I, Dr. Advait Mastud, extend a warm welcome to each one of you. On this auspicious day, as we celebrate the birth anniversary of the great visionary, warrior, and nation builder, Chhatrapati Shivaji Maharaj, where misinformation spreads faster than disease, scientific clarity becomes our strongest weapon. To enlighten us on the critical topic of debunking myths about the Medical College, Mumbai. At the same time, I respectfully invite our esteemed chairperson, Dr. Ravindra Kutte sir and Dr. Garima ma'am to kindly join us on the stage. Of inviting the Maharashtra State Convener, Dr. Tithi Banerjee ma'am, to kindly address the gathering with her welcome speech.
Today we gather on this auspicious day in the birth anniversary of Chhatrapati Shivaji Maharaj. And what could be the best thing that we are gathering here in the land of Shivaji? Shivaji means courage, strategy, futuristic vision. We are going to start our conference Youthcon 2026, and as the theme suggests, learning, leading, and living medicine. We all know that learning may be boring for you guys, so that is the birthday of the great leader Shivaji Maharaj. We will discuss the leadership with the future leaders and the future doctors of our country. With that, living medicine. So here we are not only organizing secretary of this conclave. I extend my heartfelt gratitude to all dignitaries so much. Please enjoy the day.
Thank you so much, ma'am. In an era where misinformation spreads faster than disease, scientific clarity becomes our strongest weapon. To enlighten us on the critical topic of debunking myths about the HPV vaccine, I warmly invite fertility specialist, MD OBGY associated with KEM Hospital, Wadia Maternity Hospital, GY associated with KEM Hospital, Wadia Maternity Hospital, and SATE GS Medical College, Mumbai. At the same time, I respectfully invite our esteemed chairpersons, Dr. Ravindra Kutte sir and Dr. Tithi Banerjee ma'am, to kindly join us on the stage.
चलाओ उधर टाइम वेस्ट करके कोई मतलब नहीं है. People need to be here so that they learn what they have to come here to learn. So any OB-GYNs here in the crowd? OBGYN residents? Emergency से फुर्सत ही नहीं मिला होगा. Are these undergrads or postgrads? Undergrads, very nice. तो कॉलेज से छुट्टी मिल गई कि बंक करके आए? छुट्टी मिली? नहीं तो फर्स्ट टाइम ऐसे होता ना, बंक करके फिर सुनने को एकेडमिक्स ही मिल रहा है instead of catching up on a movie or something. So sir, tell me when we are ready to go. Can I start?
Yeah, good morning everyone. I welcome our today's speaker, Dr. Supriya Arware madam, and she is going to talk on physicians leading by the way, cervical cancer elimination through HPV vaccination. Huge work on HPV vaccination, and constantly she is training the IMA members and the young doctors. So with this, I welcome madam and I request her to proceed her with lecture.
Thank you so much, sir, and respected President of IMA National, Dr. Anil Naik ji, who is being kind enough to join us for this program. Dr. Rashmi Mehta, President of IMA Mumbai West Branch. The young Karyakartas of JDN, we have Dr. Shrijit Kumar with us, who is the National Chair, and Dr. Indranil Deshmukh, the National Coordinator. We have our state coordinators, local coordinators. At the outset, let me thank the entire IMA team. We have such stalwarts amongst us. Dr. Kute, Dr. Lunge is there, Dr. Lele. So thank you to IMA for collaborating with Foxy on this very important project about HPV vaccination. And I would also like to thank my Foxy leaders, Dr. Sunita Tandurwarkar, in whose presidency this project started, and our current president, Dr. Bhaskar Pal, our Secretary General, Dr. Suvarna Khadilkar, and the entire team. Special thanks to Dr. Dilip Bhanushali, IPP of National IMA, under whose leadership this project started off last year, and our partners who are working. Special recognition here. He said very correctly that there are lots of myths surrounding this vaccine, and the entire exercise today is to get all of you to get rid of this vaccine. I know you all are undergrad students, but you are the healers of tomorrow. Our boss used to say when we were students that one day a time will come when the only thing standing between your patient and death will be you. And at that time, if you are well informed, if you have all the knowledge and of course experience and expertise to your back, then you will always make the right decisions. So let me begin this with this pre-test survey. Can you all quickly click on this QR code and fill up this survey? Only those who fill the survey will actually get a training certificate. So I think it's very nice that at undergraduate level you can get a chance to have this certificate. Please click on this and start off the survey. Have you all done with it? Can I go to the next slide? While you all are still at it, again I would like to introduce that this is an important part of the training. We need this survey so that we get a feedback. Remember, this survey does not come to us; it goes directly to ACS, and at ACS level they will be putting all the data together, compiling it, and then making a note of how much the training has made a difference. So please make sure you are doing the same. Megha, those students who are outside, can they come and click and go back and register? Just make an announcement. This is better. That is better. Okay, if you all are done with the survey, you can just start raising your hands. Thank you, sir. How nice, sir is the first one to finish the survey. Okay, meanwhile, I think I can go to the introductory talks. Yes. Can I have one volunteer from these students here to go call out those people who are at the breakfast table? Hey, बच्चा लोग, ये बैठो, या आप भी चलेगा? बाहर जो students. That is part. These women are raising children, caring for families, and contributing to the social and economic fabric of the country. And if we don't act now, death from cervical cancer are going to rise globally. And these words have come directly from the WHO Director General, Dr. Tedros Adhanom. For the first time in the history of humankind, we now have a vaccine which can actually prevent cancer. And I think this is one great opportunity that we must grab and go ahead. How can we say that we have achieved elimination of cancer? Once upon a time, poliomyelitis was thought to be unconquerable. Today, we proudly say that India has conquered poliomyelitis. No new cases have been reported in the past 5 years. And the same can be done about cervical cancer. To state that we have achieved elimination, we need 90% of the girls globally to be vaccinated by the HPV vaccine, 70% medicine. And trust me, madam, I am a distinction holder in PSM. But at undergraduate level, I never realized the importance of your branch. Today, as I stand here, I really realize that PSM is one of the most important players among all faculties.
And prevention should be the strategy for the new generation, not treatment but prevention. So our strategy for prevention or elimination of cervical cancer is HPV vaccination in girls between 9 to 14 years of age, screening for women 35 years older and above, at least the first screening at 35 years, second screening at 45 years, irrespective of their vaccination status. And if we can achieve these golden figures, we can someday claim that we have eliminated cervical cancer from our country. Of the vulva, vagina, cancer of the penis, cancer anus and oropharynx. In short, all the organs that are involved in the act of sex are going to be prone to HPV infection, and therefore those cancers can be caused by this virus and not cervical cancer alone. This will now explain why we are now pushing the vaccine even for the boys. HPV infection is very common, infects men and women alike. In fact, men often serve as the carriers and pass the women infection to women. Estimated more than 50 to 80% will get at least one type of HPV infection in their lifetime, mostly asymptomatic. Body fights off most of the HPV infection, luckily for us, in about 2 years, but not all infections can be controlled, and if it does not go away on its own, it can cause changes in healthy cells. How does it spread? It can come through a single exposure, just like HIV, spread skin to skin, the sad state of affairs. And can you believe that woman is saying, madam, give it to me, whatever it is. I said, please call your relatives. Saying, I have nobody. My husband is on dialysis. My son is having some fracture at home. I am looking after them. Please give me 6 months time so I can look after them till they are on their feet. Then I am ready to go. This is the condition of our country still. It's really disheartening and very saddening. Most cervical cancers caused by HPV in India, 84% are caused by 16 and 18. This is an important slide. 16 and 18 subtypes are the most notorious ones. There are some others also. But these being the most important ones, the bivalent vaccine, the vaccine which is against these two viruses, even if we are able to give the general population, we are talking of a resource poor country. So if even we have a vaccine which fights these two strains, I think we can win our war in a big way. Persistent and cause infection, best treated with, okay, now these are the prevention of HPV infection and HPV vaccine facts. How can we prevent, or what are the prophylactic vaccines? Permutation and combination of doses have been studied against HPV 16 and 18 infections, and there is no significant difference in efficacy receiving one dose or more, and therefore very soon the single dose regimen is going to come in. But till such time that comes in, beyond doubt, excellent safety profile, WHO Global Advisory Committee on Vaccine Safety has given various trials, various studies, and WHO SAGE position paper 2022 says that it has detected no serious safety issues to date except rare cases of anaphylaxis. Anaphylaxis is something can occur with any and every drug that you register. Sir, mere paas na, no, I'll find out. Don't give half-baked answer. हाँ ते ठीक आहे ऐकले खरं काय मला नाही वाटत त्यात काय अर्थ आहे असं म्हटलं का बस you have destroyed the with which that person has come to you. So give well informed information to your patients. There are some questions that the patient may ask. Does the vaccination work? Yes, it is now proven without doubt the efficacy of the vaccine. Does it cause side effects? Not many long-term side effects. There may be some mild local reaction and all, anything which any other vaccine affects for the first 2 days, and then it will be gone. There are no long-term side effects, and most, like I said, concern about fertility. हमारी बेटी से शादी कौन करेगा? So please reassure them that the fertility is not harmed by giving the vaccine. Can she not get the vaccine after age of marriage? Need to explain to them. Just like a polio vaccine is not given after person gets the polio. It has to be given at birth or at young age so that the immunity is formed over years. Similarly, she needs to take the vaccine now so that the immunity will form over the years and she will be well immunized by the time she actually has her first sexual exposure. Also, you children know better than me that marriage is no longer the starting point of sexual career. It starts much ahead of that. And the better you explain to the patient parents, please don't delude yourself that your daughter will have sex only after or your son will have sex only after they get married. So please, if you want to prevent cancer in your child, start the vaccine. Organizations, NGOs are giving it free as a part of CSR. You can tie up with some NGO and offer it free to your deserving population. Can boys get HPV vaccine? Yes, they have to get. In fact, it should not be a choice because, like I said, it can cause 5 minutes more. Penile cancers, it can cause oropharyngeal cancers and anal cancers. So yes, they also need to be protected. Role of doctors critical, putting the pieces together. So we have partnered with so many organizations, the American Cancer Society, WHO, IMA, IAP, FOXY. It is now time, we are the important, kadi, like I said, whose chain ki kadi hum hai as an individual. And at our individual level, it's high time we, started acting. So the key takeaways for today's talk is, HPV is a very common infection, can cause 6 types of cancer, and we have a vaccine which can prevent it, which is very safe, effective, and your recommendation as a doctor absolutely matters. There are not enough children being protected as of now, and therefore awareness among the medical fraternity needs to be stepped up. Now we are going to have the post-training survey. So please again click on this QR code, fill in the post-training survey so that you become eligible to get a certificate. If there are any queries, any questions, please feel free to ask. And FOXY, which is our apex OB/GYN body, has a adolescent health committee dedicated to adolescent health work. And by the blessings and love of all my friends, I am now the chairperson of the Adolescent Health Committee, national body. And I am requesting my leadership to allow me to form a student and residents wing of the Adolescent Health Committee. Any one of you who is interested in working, whether you are planning to become an OB/GYN or no, any fraternity, students, residents are most welcome. I will leave my number with the organizers. Please get in touch with me, and I will be really happy to have you guys on board. Catch them young and watch them grow is what you are the caregivers of tomorrow, and we would really like our work to continue with more and more motivated doctors giving back to society. We all know, even in government institute, the population and the government is spending a lot of money to train one doctor. And as our responsibility, we should give back to society. And if any of you would like to do adolescent health, vaccine related, any activity, please be in touch. I have slides which I can offer to give you. You can go in your communities. As resident doctors, you are extremely busy. Doesn't matter. One day in the OPD, if you can find time, catch 50 patients.
Big round of applause.
Thank you, sir. Thank you very much, sir. Very kind of you, sir. Thank you so much. आज शिवजयंती आहे सर, बोला तुमचे काय कमेंट्स.
Congratulations, madam, for the excellent presentation.
Thank you, sir.
And at the outset, let me congratulate JDN team for excellent arrangement of Youthcon 2026. Regarding the vaccination, it is need of the hour, as told by madam. 9 women, they are dying in 1 hour due to cancer cervix. It is safe and effective. More than 5 million doses are given. No long-term side effects, as the first vaccination was given in 2006, so almost 20 years are over. No harm to the fertility, but it protects it. Age 9 to 14, it is the age of robust immunity. To be given to boys because penile, genital, oropharyngeal cancers are common. Maharashtra is leading, but still we want to increase number of trainers as well as the vaccinations.
Yes.
So that is the take-home message.
Our local level, think globally, act locally. That is exactly what I am trying to say. Till such time that it comes as a free vaccine, we can always, it's not necessary that a poor patient should be charged. Lions Club, Rotary Club, Giants Club, they are doing, universally they are doing this.
Yes, madam, they are doing, but in the private setup, whenever we organize such an event, so the cost is also effective.
I agree.
So
And
last
Sir,
time,
Serum Institute themselves have now approached me I am sure they will approach various, that they want to do it as a CSR.
Yeah.
So they are, roping in the funding also. They are bringing in NGOs who will fund them. He said, madam, you organize, give me a number, we will try to bring the fund. For them, it's a win-win situation. They bring a funder, they get the money for the vaccine, the patients get it free, they get a little name. So there are people who are doing it so that.
So when we are talking about vaccination, we should not only focus about the educated and the elite people. We have to focus about the people, the poor people, in the community level, because they are the contributor of the maximum burden of this cancer.
Correct.
And this is a preventable cancer. As Sir was asking about the vaccine, yeah, Gardasil is a very costly vaccine and it's not practically possible to give everyone, neither from the government side, neither private, it's not possible for them. So India has already started working on that. They are planning to make it indigenous vaccine. I think there is a conference.
Bivalent one, I think they will go out for the free one. And the quadrivalent one is the one which is reasonably priced.
Reasonable.
Nonavalent is definitely very expensive.
In Tata, there is a conference regarding this cancer only. They said they are planning and they might launch this Cervivac vaccine with only in the cost of 250 rupees. So it will be very reasonable for the middle class and the other people, and for poor people we can at least afford that, or the cheapest vaccine. So that is why, but till the time we are not getting the vaccine is one of the preventive mode, not the only. So
thank you so much. It's really short on time. I request Dr. Ravindra Kutte sir to please felicitate Dr. Supriya Arwari ma'am. May I respectfully invite Dr. Suresh Kagalkar sir to kindly felicitate our honorable chairpersons, Dr. Ravindra Kutte sir and Dr. Tithi Banerjee ma'am. I request Dr. Tithi ma'am to kindly felicitate Dr. Ravindra Kutte sir. So please come on the stage. Thank you, sir. Thank you, ma'am. It is now my honor to invite Dr. V.S. Hariharan, sir, internal medicine specialist, consultant emergency physician at Glen Eagles Global Health City, Chennai, to take the stage. In the world of clinical medicine, accurate interpretation can change outcomes.
he will be our he of 200 cannot mean anything unless you have a clinical context to it. So that is what. In the initial phases, I think it is better to check the reference values. So you may miss a few, so there is always a reference value and then it is very important to identify patterns. So your thyroid function test is a complex thing where your TSH goes low, the T4 and T3 rise. So the patterns have to be identified. Very, very important to correlate these labs to the clinical finding. And then have a differential diagnosis and a management plan based on it. In the initial phases, as students, I think you need to have two things. One is have a set of normals, a cheat code with you, so that you know what your numbers are. Second is to know the critical values. Like for hyperkalemia, I think it's very important. Calcium levels after a point becomes important. So have a critical lab value alert with you. There are so many. I think you can, each one of you, depending on the department that you work on. So these are the lab values. I think it's for all of you to see. So someone, can you interpret the lab values for me? I have only 4 cases. We'll just finish this. By the end of 4, you'll learn how to start doing this. Someone from behind? Or should I continue to talk? Yeah, I think I'll continue to talk. Very silent crowd. Someone wants to put your hand up? So here the WBC count is high. Lots of neutrophils into it, and the platelet count is slightly on the upper side. This happens typically in infections. So it can happen in inflammations too, but then here we are thinking about an infection. Here the ALP and GGT are high again. The bilirubin is slightly high. The ALP, an acute kidney injury, knowing the baseline, and CRP says infection. So you need to know something called the what is fever, jaundice, and upper quadrant pain. Charcot's triad, right? So what is that? It is something to say there is cholangitis, and here it is an obstructive lesion. So we think, what's the next thing you will do? We'll ask for imaging, we'll admit this patient, we'll start on fluids, probably we'll start on IV antibiotics after taking a culture, monitor urine output, and then we'll probably get a gastroenterologist involved. So I think it is layered. It is not just looking at the labs and getting it. I think you have to know the story behind to tell. It's like a 70-year-old man, decreased urine output, confusion, and generalized weakness. He's a hypertensive, diabetic. He had some knee pain, so he took some Brufen over the last 3-4 days, and then his urine output dropped, and he started developing edema. This is the labs for you. Someone wants to answer this, or you want to remain silent? I thought Mumbai would be much more talkative than, Chennai is a silent crowd. Mumbai is even more silent.
I request everyone to ask questions.
Yeah. Okay. So, based on this, do you want to just tell the labs, infer the labs for me?
Creatinine is raised.
Yeah, creatinine is raised.
PO1 is also raised.
Okay.
Potassium is also raised.
High. Okay.
Sodium is slightly low.
Slightly low. Great.
Bicarb is also slightly low.
Great.
And anion gap is
So
high.
there's a ABG. What does the ABG say? 7.28 pH. PCO2 is 32.
It is a metabolic acidity.
Yeah, it's a metabolic. High anion gap, metabolic acidosis. So as you told, all the numbers are there for you. So what is this? So you need to know the baseline creatinine to say whether this is an acute kidney injury or a chronic kidney injury. So his baseline creatinine was around 1. A rise is 3.2. So only if you know the background history, the past history, you will be able to tell. So this is an acute kidney injury. The hyperkalemia, I think you need to act fast because history you will be able to tell. So this is an acute kidney injury. The hyperkalemia, I think you need to act fast because it's something that can be life-threatening. The hyponatremia is mild, dilutional, I guess, and the metabolic acidosis. So I think only if we know what to do, I think we can start working on it. So correct the hyperkalemia, get an ECG done immediately so that you know where your heart rhythm is, and then stop all the NSAIDs and your AC inhibitor, all of them are nephrotoxic, and then assess this person's volume. If he's dehydrated, he needs fluids. If he's on the higher side, he'll probably need dialysis as well. So a renal ultrasound will tell you what is the kidney shape, if there's it's the size of the kidney, if there's any obstruction, etc. So, and get a nephrologist involved at this point. So I think it is very, very important to know the baseline before you interpret any other investigation. That's the learning for here. Okay, this is another easy one. A 32-year-old woman, palpitation, weight loss, heat intolerance, no history, no past medical history, has fine tremors, tachycardia, has a diffuse swelling in the neck. These are the labs for you. Did not the gland or not, you can just get an ultrasound and then start for a definitive treatment. So the definitive treatment could be pharmacological, surgical and radioactive. Great. And whenever you have this, check for complications. So people with long-standing thyroid disease can have atrial fibrillation, so have a good count of your pulse, can have osteoporosis as well, so have this. So I think this is case 4. 58-year-old man with chest pain and shortness of breath. He has hypertension, dyslipidemia. The ECG is there for you. Those are the troponin and the myoglobin value. What is this? It is STEMI. Great. So, ST segment elevation and your enzymes are high. So, one thing that you need to know is troponin is very sensitive for myocardial injury. The CKMB and the myoglobin generally rise early but are not very, very specific. So I think troponin is the specific test. And certain times when you have difficulty, your first troponin is normal, your ECG is still normal, and then you think it is cardiac. I think it's better to repeat the ECG and have serial troponins repeated just to see. And then if it is someone with CKD, your baseline troponin itself can be a little high. So there again the serial troponin measurement becomes very important because it keeps racing. So I think that is where this stand. So this patient needed to get the STEMI protocol activated. You either thrombolize or shift this person. Okay, you shift this patient to a cath lab. So this is where. So always interpret labs in context of patient's history and examination. Look for patterns. Don't look at isolated abnormalities. Use trends over time to address progression or response to treatment. Be alert to cognitive bias. When in doubt, seek a senior's help or a specialist help. So always know what are the critical values and when to escalate. And I think because of short of time, I think let us interpret labs in a more structured manner and let us be vigilant for lab errors, and then let us escalate for a deteriorating patient. When there is something that is going wrong, let us escalate. So before I close, I will like another scenario told, and I want you to answer. This is a 34-year-old guy. He has fever, cough, running nose. One of your juniors has got a CBC, a urine routine, and a Vidal test. The Vidal is 1N 160, O and H positive. The counts are normal, urine routine is normal. What's your diagnosis? No. No. So after listening to me for the last 25 minutes, I think it is very, very important to know you have to correlate critically. Vidal is an outdated test. I have not done it for the last 20 odd years. I think Vidal can be positive, at least in India for a lot of us, because we are all always exposed. Always correlate clinically. Thank you for the opportunity.
Thank you so much, sir. I request the chairpersons to kindly ask questions if they have any.
One thing is that the lab to lab variation always there, and we have to repeat the many of the times the values. As you said, the correlation is very important. So how to make standardize about the different labs? The patient come immediately with all these values. Some might be higher. When we make here standardized lab, we think of our side.
Sir, it is about two things. One is having all the labs being standard. Then certain values like your PTINR differs from lab to lab. There are the normals for thyroid functions may slightly differ from lab to lab. So it is very important to know what methodology the lab uses to give the report. So I think that also we need to have. I think I didn't mention that, but then this is very important.
Thank you, sir.
Sir, only a great teacher like you can do such a beautiful presentation in the span of 20 minutes. Give it a round of applause. Friends, one thing most of you are not knowing, that you can get MD medicine equivalent degree soon after internship. But I can't नहीं पता. MRCP is a world recognized postgraduate degree of UK, can be done soon after internship. Okay. And sir is a great teacher of MRCP. That's why he could do such a beautiful presentation. Give a big round of applause. Thank you.
Thank you, Dr. Haring, for a wonderful, sweet and short presentation.
I also request Dr. Mukesh Bhatia sir and Dr. Suresh Kagalkar sir. Pleasure to have you on the stage.
Or how many of you think it will be very hurdlesome, troublesome? It's not that easy. How many of you think? Now only the hands raised. So it is my job to address this second part. because, you know, India is producing so many MBBS graduates, 1,10,000 MBBS graduates every year, right? Some of the states have already crossed the WHO standard doctor-patient relationship of 1:1,000. Many of the states have more medical colleges. So, naturally, there is a question, there will be a question genuinely that what will be my future in India. India is a big country, right? So my job is to tell you in one word that you will have, we are a big country and you will have some space exclusively for you to establish your career. That's why I have chosen this topic of instilling a positive thing in your mind, right? In 6 divisions in my topic, there is a paradigm shift in the scenario. When we started our practice, the scenario was different. Today it is different. How it is different, I will explain. Doctor entrepreneur paradox and avenues for medical entrepreneurship and the critical plus cybersecurity, financial literacy and leadership and the IMA connection, right? What is the thing? When I started my practice some 25 years ago, people used to come only for my name, right? Individual doctors very, very famous. Mumbai, leaving my hospital there, still people will come for the sake of the hospital, right? Even somebody is treating, they will agree. Well, all know, I will deal it later. Clinical skill is now a baseline, but not the differentiator. There are so many things, you know, it's coming to more than clinical skill, imaging, treatment, machines, everything. Right? There is a growing population in India, right? Equaling to the growing number of doctors to 39, 40 years, right? So, address the issues, health issues of that particular age population, right? And you know, there is, India is becoming very stronger economy, probably by 2047, Viksit Bharat is announced. We may likely to come next to America, the economy, about $40 trillion economy. So, the increased option in healthcare financing also. This is the first time in the health budget, last February 1st when finance minister presented. First time it has crossed more than 1 lakh crore for the health alone. The first time in the history of the independence. So more than 1 lakh crore was sanctioned for health alone, this budget. So we are now only the next to services, showing one person. He is kind of biggest entrepreneurs in the medical field, right? Patrick. So apart from being a doctor, so he innovated and invented a good drug for cancer, Abraxane, and become he is the richest person in the world. Richest doctor in the world. I will show you other biggest entrepreneur in the history. First woman MBBS doctor from Chennai, who had established one of the biggest institutions in the country, that is Adayar Cancer Institute. You heard that name? Adayar Cancer Institute was established by a woman doctor from a rural area called Pudukkottai, and it is serving the entire nation, right? The vision after MBBS, he dwelled into private practice, general practice. After that, they entered into politics also in the Congress party, became an MLA in the Congress party. He wanted to save millions of people afflicted with the cancer. That's why he established this Adayar Cancer Institute. This is a person, Pratap Reddy, who brought in quality care to India by establishing chains of Apollo hospitals there. So really it transformed what is the medical care, what is the health care, people who could afford. And his daughter Satish was established a scheme for poorer patients. He was established a scheme for poorer patients, cardiac surgery in the Narayana Idale Hospital. And Dr. Arvind, Dr. Govindappa, who established Arvind High Hospital, right? You know that big institution. This gentleman started this establishment after his retirement at the age of 60, right? You take from the poor, take from the rich and serve the poor. This is the idea of this entrepreneurship. Then come to what are the areas you can really enter into entrepreneurship by establishing your own hospital, single specialty hospital, secondary care, tertiary care hospital, neighborhood clinics, as I said. What is the things necessary in that particular area, you can do that. Diabetes center, huge scope for diabetes center, rehabilitation center, daycare surgery center, mother and child care. Medical college, now medical colleges are almost saturated. You can start nursing college. If you have all the sources, nursing college and allied, healthcare institutions, allied healthcare institutions, alternative medicine hospital, wellness, diagnostics, another important area. Definitely we can dwell into laboratory, radiology, imaging, and other kind of activities like home healthcare, healthcare IT. There are so many things. You can, from now onwards, you can keep thinking about it. And starting diagnostic health is a very good idea today. And the many successful ventures are there in the field today, right? And you have to have a very good feasibility report about how many doctors would refer the patients to you. All these things, a good feasibility report will definitely help you. This is one important thing always you can keep in mind. Diagnostics and the imaging center will have a very good scope in the near future. There are so many wireless digital technological equipments in health, like you can wear some wearables to which measures your pulse, saturation, and everything. There are a lot of things, such things are available. Google Eye, Google Glass, and enlarging. You know that what is the fitness industry? So many fitness centers are coming up every day. University. Another is wellness industry. This fitness industry and wellness industry are started by doctors today. Earlier it was not doctor. Now the doctors themselves start. Definitely it will have a leverage of running this kind of industries successfully. My dear friends, India is a huge country where take any type of treatment, take any type of cardiac surgery. Number one country in the world which is doing so many heart surgery in India. Number one country in the world that doing so many transplant surgeries in India. So everything is done in a large scale. Everything is available. And the India Vision 2020 report said physicians, nurses, medical technicians, and other scientific occupations will become growth industries to rival IT sector. I told you in the beginning. So ours is growing fast. Health sector is growing fast as comparable to IT sector industry, which has the employees of both sectors almost equal. Right? In India, if you take, the employees of both sectors are almost equal. So finally, I would like to suggest you a few things. Skill is very important. So learn skills when you are in the institutions. The skill makes by me, in fact, this is the entire story of healthcare in India, from the ancient healing to the digital health. So another one is 100 ways to become an inspiring IMA leader. This all will give you tips how to overcome the hurdles which are faced today in establish your medical profession today. This is another important venture by IMA is IMA Employment Career Facilitation Bureau. And I am also part of it. We have launched it. If you click on IMA for Doctors, www.imafordoctors.com, if you go there and you will see this, and you just log in, it is free for all people, junior doctors, it is free only. If you log in, and there are umpteen number of employers, that is hospital owners are already there in the portal. They will be able to see what is your specialty, what area you would like to work, and you will be getting a genuine job with a genuine remuneration also. And finally, from HBA.
Excellent talk on a topic never heard. We keep on listening to diabetes, hypertension, but nobody has discussed something where we can reach the great height of success. Sir, a big round of applause. And a very good carry-home message from him. All of you should become a member of IMA. Plus tell your friends also to become a member of IMA, so that we all go together. Long live IMA. Thank you very much, sir. Amazing. It's too beautiful.
Thank you.
I'm grateful and honored to share the stage with the two stalwarts.
It is also important for this purpose. So these things you please keep in mind, and shall almost cover all things. So thank you very much.
Thank you, thank you. Finally, for all this to happen, always keep learning. Learning is a continuous process. If you learn everything, continue to learn till our last day, it will help you in our venture.
Now to express our gratitude and appreciation, may I respectfully invite our chairperson, Dr. Mukesh Bhatia sir, our co-chairperson, Dr. Suadeep Bose sir, and Dr. Anirban Dalui sir, to kindly come forward and felicitate our esteemed speaker, Dr. K.M. Abul Hassan sir, as a token of our admiration and thanks. Thank you, sir. Okay, moving ahead. Despite that, my own personal wealth, I never really took it seriously because I thought, I'm young, I'm 25, 26, 27. I don't care, I have a lot of time. I'll make money for another 30 years. So I'll start investing later, I'll spend money now. So you end up buying pointless stuff. You will buy your latest iPhones, you will spend money on maybe traveling, which is still fine. And then then as you start earning more, you have more ambitions, you want to buy a car, you want to buy the latest watch, you want to buy the latest shoes, and whatever that may be. And you do end up spending a lot of money. I said, investing requires three things: capital, you'll get that through your salary, save 20% of it. Secondly, time. Time is more important than the percentage of returns that you will make in your investments. And third is discipline. The discipline of saving that money every month. Come what may, you might have some expense, you might want to buy something new, but you must always save that money. That money is something that is untouchable for you. And for regular people, mutual funds make a lot of sense. I will give you an example also. If you had 1,000 rupees to invest, today you will not be able to buy even one share of, let's say, a Reliance Industries. It is trading at more than 1,500 rupees. You will not be able to buy even one share. So let's say a very small number of 11,000 rupees per month. Most of you will be able to do much more than that. You'll be able to do far more than that. And you can do this by not spending too much of your bandwidth as well. And in 30 years, like, this number is massive. It's like 12.5, 13 crores. And you can compare this. So this was the point I was trying to make. If you look at the first 10 years, it's only grown to 38 lakhs, close to 40 lakhs. But in the next 10 years, it does its job. It will come to 2.2 CR. And these amounts are very small that we've taken. These amounts will go up materially as you keep increasing. And even the returns that we have assumed here is only 12% annual returns. We've not assumed something very crazy, or we've not assumed you're going to take some crazy amount of risk. Think of getting advisors once you start making your money. But if you want to keep it very simple, you can do simple stuff like, because you guys are young, you guys are very young, you should have exposure to the mid cap and the small cap sort of space where you make a lot of returns. If you can hold on for 5 or 10 years, and you definitely can. You guys are very young and you should be able to take that. And let's say if you were an older person, the advice would be very different. You would ask them to do a little bit of, let's say, even FDs, or invest in something like a Nifty 50, something very safe. But as you progress through your life, as you get older, that's when you should start deploying this money in some more years later with a higher contribution. So this is the power of time. Because over every year, if you put 100, you get 10%, it becomes 110. Next year,
your 10. If you earn again, it will be, you'll earn on that 110, you will not earn on the 100, which is called compound interest for a reason, which is why there is significant power in questions. You can ask me now, or we also have a booth outside. You can ask. Me and my colleague will be there for a while, so you can definitely ask us.
She has a question, sir. Sir,
Hi, I'm Dr. Shreya. So I had a concern about, we spoke about the long-term plans, right? So what about short-term plans? Like in case, because as we know, as students also, right now I've passed out, I'm a doctor, but going ahead for studies abroad or even maybe PG in India, we would like to, there are times where we would like to fund our own, education sometimes. So, what about the short-term plans? Are there any options in that?
Before sir start your answer, just 1 minute I will take. We just have our chief guest as the chairperson of this session, Dr. Amal Gite sir. Sir, please come on stage. Yeah. Sir, please continue.
Thank you.
Yeah, so that's a very fair question that you asked. So there are options for short term also. So there are products called debt products. You will see names like, for example, if you take a big mutual fund like an HDFC. But let's say you have a portion of your money where you want to take risk. That is fair. If you say I have 100 rupees, 10 rupees I will risk. I will literally do something very, very high risk. If you want to do very high risk, this is not the vehicle also to do it in. It is better you directly buy a stock if you directly want to take a risk. And for you guys, it can be easy also, because in your profession, you can understand businesses like hospitals very easily. You will understand it better than I can. So you know why a Apollo Hospital or a Max Healthcare, they are all listed companies, right? Why is one better than the other? There are many hospitals that are listed today. So if you want to take very high risk, you can do that. But to your question, if you want to stick to mutual funds, it is better you stick to any active.
I would like to add is that medicine gives us what? Respect. Money gives us what? And financial stability gives us by investing in these mutual funds. So it gives us peace. So if we invest in financial, it will give us peace for the better future. Thank you so much.
Thank you for that, and that's a very beautiful point made also.
Thank you so much, Chairperson, sir. It was really helpful, as we always require a financially stable mutual fund to help us grow along with our career. Now I request Chairperson Sir, Dr. Amol Gite Sir and Dr. Rahul Anand Sir to kindly come forward and felicitate our esteemed speaker, Mr. Aditya Mulki, as a token of our admiration and thanks. Now I request Dr. Chinmay Sir to kindly felicitate our Honorable Chairperson Dr. Amol Gite Sir and Dr. Anand Sir. Thank you, sir. The topic is highly relevant, forward-looking, and crucial for every medical professional. Any guesses what's the topic about? Yeah. It's AI and digital health in India. What every doctor must know before 2030. I now have the honor of inviting our esteemed panelists to kindly take the seats on the dais. Dr. Chinmay Sahu, Dr. Garima, Dr. Rahul Anand, Dr. Chinmay Akre, and Dr. Tithi Banerjee. And to lead this important and dynamic discussion, I respectfully invite Dr. Anirban Dalui Sir, Honorable Assistant Secretary, IMA Headquarters, Associate Professor IMA Maharashtra GMC, to moderate the panel. Waiting for Dr. Anirban Dalui Sir to come downstairs. Okay, Dr. Anirban Dalui.
Good morning, dear delegates and the participants, and good morning the panelists. So I think you can see it like a little bit radially. So So we have amongst us Dr. Chinmay Sahu, Dr. Chinmay Akre, Dr. Garima, Dr. Rahul Anand and Dr. Tithi Banerjee. So I request all the panelists to introduce yourself with your designation, both the academics as well as the JDN. Chinmay.
I am Dr. Chinmay Sahu, Medical Education Director of IMA JDN National, and I am a body pathologist at SU Medical College, Cuttack, Odisha.
Chinmay, good morning. I, Dr. Chinmay Akre, is a Membership Director in National IMA JDN and immediate General Secretary for the State IMA JDN, and currently working as a Medical Officer under NH.
Good morning everyone. I am Dr. Garima, National Joint Secretary IMA JDN and International Secretary for Commonwealth Medical Association, Young Doctors Foundation. And
it's likely from like the telemedicines, like the bridging the urban-rural division to AI unraveling diagnostic complexities, the possibilities of artificial intelligence and use of the this domain in everywhere day-to-day practice is huge and immense. And the challenges like data security, equity, gaps, and the illiteracy about this all these AI, that is also prevalent. So our distinguished
panelists of comprising of pathologists, surgeon, clinicians, public health expert, and other frontline practitioners. So we shall discuss the innovations, the opportunities, as well as the drawbacks and the challenges of AI in Indian healthcare scenario. And these ideas, this discussion will reflect and some questions will enrich us, as well as they can raise some questions, raise some take-home messages to discuss in future. So without...
But medical legal cases will be definitely handled by the doctors. So it will basically, doctors have to be more to integrate the slides, and it will help in the repeating the burden of slide checking, the slide scanning.
So basically the pathologist will remain there to scan, to verify or to modify the results, which is primarily done by the artificial intelligence. Is it? Okay. So
yes.
With this note, I wanted to ask Chinmaya about what is your suggestions for the future budding physicians and the pathologists who will take the subject in future as the career opportunity. So what will be your suggestion for them?
Basically, my suggestion should be that they have to be more regarding the interpretations, like this technical aggravance to the pathology will be reduced.
So I'm going to next to Rahul. So he's a budding, already a pediatrician. Sorry, I don't say the word of budding. So for the pediatrics, the AI is quite difficult to interpret because the patients itself, they don't utter the words what is happening to them. So what is your opinion to involve AI into the patient?
AI, we will be able to know. In fact, we have done 2 or 3 tests of CRPs and CBCs. If we integrate it with the AI, we will almost be able to know what are the antibiotics that we have to focus on. When will the baby be having any problems related to then we have to transfuse or not, when we have to change the antibiotics, go to the next generation of antibiotics. These are the with the sepsis. What the other things that we can include is regarding the growth monitoring. What happens that once a baby is born, if it's a small gestational age baby, large gestational age baby, what we do is we have to monitor the growth, and that we do in a chart format. Right now, what we practice is in a chart format. If we integrate it with the AI, what will happen? That it will keep monitoring it. We don't need to rewrite it and all. We just need to monitor, and the AI will help us to know that what the other differences that had happened within 1 month, 2 years, 3 years. This,
along with your predictive scores and etc.
No, sir, that is not going to do anything with the physical examination. The one thing it is going to help with the burden. India ka fertility, the ratio is very high. So, बच्चे तो होते ही हैं.
Still it is.
Yeah, now it's decreasing. But now it's decreasing trend pair. But basically is that the burden on the pediatricians are a lot. If you work in an ICU, work in a ward, there are two different things. There are a lot of deliveries going on. There are a lot of childs and not a lot of sick childs. Nowadays, the IVF, there are a lot of things that have been coming. So it will help us in reduce the burden of the pediatrician. Because there are a lot of burden going on. There are a lot of sepsis, there are a lot of things. So basically,
and even it will help in the AI we can say it can help surgeons in 3D construction of an organ, the risk predictions which all can be there, personalized particular to a patient, the personalized approach which we can follow, or the mapping of the surgery. So this is the pre-required side, we can say the pre-operative, we can get a basic idea, and then it can definitely help us.
Okay.
Yeah.
So I got your point that the robot cannot do anything without our help. But one thing that came to my mind, that whenever there is any medical legal issues that struck in any complications, so what should be the role? Is the surgeon is responsible or the robot is responsible? So we need to sue the robot. Please.
So definitely, in this, the operating surgeon is going to be responsible. We can't outsource the responsibility to a software. So because the surgeon was the one who was operating or handling the things.
Yes. Yeah. So may robot can take all the burden of a surgeon, but the most important burden of taking the responsibility of medical legal issues that lies every time. Our next panelist, who is a public health expert, Dr. Tithi Banerjee. So for Tithi, I would like to ask that the public health is completely relocalizing its area on different domain related to the AI, artificial intelligence and digital health. So there are so many apps related to the public health tracking, the infectious disease tracking, the auto sensing, auto replying, automated resource handling. So everything, and the data collection also through some app also. So how AI is relevant?
When we talk about public health, so public health is a domain where data is a stethoscope, and the similarity I would say it's D to D. Like public health deals with 2D. One is data, from data to decision. Now there is an addition of another D, that is digitalization of health. When we talk about AI, we cannot remove digitalization. So all these have already happened. Sir has already mentioned about few of that, like the app, like e-wing, co-wing, and after COVID everyone is aware about all this. Aragya Setu app, where you can just put your symptoms and they will give an analytical view of that what is your risk of being in COVID. So all these are already there. How it can help us in a community level, that is now we are shifting from response, giving importance from response to a prevention mode, where previously we used to track the outbreak, and after the outbreak is already happened, then we start the response. Now we are more focusing on doing the prediction. What we do the analysis, we do the forecasting of the risk, we do the assessment, then we do the preventive measures we used to take. So that is how we now can limit the disease, limit the pandemic.
Basically dealing with the data so much. So what is the risk of having this AI with the data? What is your take on that?
When we talk about the risk, so I just remember when the computer first came into India, there was always this question that is there any risk of using computer? Is it going to snatch out the job? So no, it's not like that. It's not going to replace the doctor, because AI is a helping tool. It can minimize the time of the work, like the analysis of the data. It can do the analysis a large amount of data in a small time. So it can reduce the burden, but it cannot replace. But what is the problem? Because community medicine or public health mainly work based on the data. Data is our stethoscope. So that is why if the data entry, because how AI works based on the algorithm. Whatever data we are feeding to them, it is going to reflect its analytical view based on that. If the feeding data itself is faulty, so we call it data garbage. So if the data is not adequately filled, inappropriate, missing data, then obviously the AI will be trained in a like false data. or the prediction will be false, so the result will be false. Then underestimation or overestimation may happen.
Magic solution. For it to function effectively at the primary center level, we need 4 things. I will tell: reliable infrastructure, trained human resources, workflow integration, and most importantly, community trust. Reliable infrastructure refers here the stable electric supply. Trust in the treating doctor is paramount. AI should support the clinicians and not replace the human interaction. So the key point I will make here: technology alone cannot solve the systemic healthcare gaps. AI is a force multiplier, but only when infrastructure and human capacity
take the students who are going to be graduates.
My message for the students would be regarding the
Our future generations.
Time we have to update ourselves, like we update the software in our mobile. So AI is the new trend, new era. So you all have to train yourself, the future doctor, in AI. ChatGPT and Grok you all are using. So now for public health and overall in the health system, AI is integrated. AI is already infiltrated in this field. So learn about AI, update yourself so that you can deliver a better future, better healthcare for the population and for the
As we conclude this intellectually stimulating discussion, we now move forward to a very significant and symbolic moment of the day, the inauguration ceremony. Every GATE initiative begins with a formal step of commitment and vision. With immense pride, we now proceed to the official inauguration of Youthcon 2026. Okay, everyone. May I respectfully invite Dr. Rashmi Mehta ma'am to give welcome address to guests and dignitaries. She is the President of IMA Mumbai West, Vice President of IMA Maharashtra State, and an elegant practicing surgeon in Mumbai. Please, ma'am. A big round of applause for Rashmi Mehta ma'am.
Thank you, Atul. Good afternoon, everybody. IMA Mumbai West branch warmly welcomes all of you. We are proud members of this august association, Indian Medical Association, and our legacy, the ones to carry our aims and objectives of practitioners of modern scientific medicine are the IMA JDN, Junior Doctors Network, and MSN, Medical Students Network. We at IMA Mumbai West have always endeavored to support them over the last few years by guiding them and facilitating various activities of theirs. I am humbled and honored that for the second time in my 1 year of presidency to be hosting their program. When we got the call from Dr. Indranil Deshmukh, we agreed immediately for this conclave. With the staunch backing of the branch, especially Dr. Jayesh Lele, we have been able to help them. I am in awe of these JDN and MSN students. They are so vibrant, active, and looking into activities beyond academics, student welfare and student prospects. They work cohesively, yet each one does the allocated job and completes it as a team. If I were to be a medical student once again, it is to become an IMA MSN member and an IMA JDN member before becoming an IMA member. Students, please remember that IMA Mumbai West is always there for you. We are grateful to all the dignitaries for gracing the branch on this occasion. National President Dr. Anil Kumar Naik sir, Honorary Secretary General Dr. Sarbari Datta ma'am, Honorary Finance Secretary Dr. Piyush Jain sir, all the dignitaries who will be on the dais and off the dais. A very warm welcome from IMA Mumbai West branch, and a big thank you for making this conclave one of its kind. Now, without taking up more time, I would like to invite National Secretary IMA JDN, Dr. Indranil Deshmukh, to take the podium.
Thank you very much, Rashmi ma'am. A very good afternoon and a very warm welcome to one and all present here. On behalf of the Indian Medical Association Junior Doctors Network, it gives me an immense pleasure to welcome you to the Youthcon IMA Junior Doctors Network West Zone National Conclave. Today marks not just a conference, but a collective vision of young doctors united for the academic excellence, leadership, and a national collaboration. Before we commence the inaugural ceremony, I would like to respectfully invite our esteemed dignitaries, the torch bearers of the Indian Medical Association, to kindly grace the dais. I request Dr. Kanhaiya, Dr. Chaitrali to accompany our guest to the stage. It is my proud privilege to invite Dr. Anil Kumar Nayak sir, the National President of IMA. Dr. Sarbari Datta madam, Honorary Secretary General of IMA. Dr. Piyush Jain sir, Treasurer of IMA Headquarters. Our National Chairman, Dr. Srijit N. Kumar sir. National Joint Secretary of IMA Headquarters, Dr. Vasant Lunge sir. Past Honorary Secretary General of IMA, Dr. Jayesh Lele sir. National Chairman of IMA Medical Students Network, Dr. Shiv Kumar Utture sir. State Secretary of IMA Maharashtra State, Dr. Vikrant Desai, sir. And State Chairman of IMA JDN Maharashtra, Dr. Rajesh Dere, sir. May I request a warm round of applause as our dignitaries take their seats, and most important, our IMA Mumbai West Branch President, under whose leadership we have planned this event, Dr. Rashmi Mehta ma'am, to sit on the dais. On this auspicious occasion of Chhatrapati Shivaji Maharaj Jayanti, we feel deeply honored to host the conference of IMA Junior Doctors Network. Chhatrapati Shivaji Maharaj stands as a symbol of courage, visionary leadership, discipline and unwavering commitment to his people. As young doctors, we draw inspiration from his ideals of dedication and service to the society. May this conference reflect his spirit of resilience and unity and motivate us to work tirelessly for the betterment of our profession and our nation. Although this event titled as a West Zone Conclave, we are proud to share that junior doctors from Jharkhand, Uttar Pradesh, Telangana, Andhra Pradesh and Bihar have registered for this event. Our vision is clear: to take such academic and leadership platform to every zone and every state of the country. To begin this auspicious occasion, we shall now proceed with the traditional lighting of the ceremonial lamp, symbolizing knowledge, wisdom and unity. I humbly request all the dignitaries on the dais to kindly join us for the lamp lighting ceremony. Which will be rendered by Dr. Titi Banerjee, the State Convener of JDN Maharashtra.
So, JDN, I think, we will emphasize more because it is the entry level of membership for young doctors. If we concentrate here, after 35 age, then the senior IMA, as per our constitution, we do. For this year, we enhance and within next 6 months we have planned that each and every medical college of Maharashtra, maybe private medical college, maybe government medical college,
Rashmi ma'am, and all senior leaders, Dr. Thakur. But now we had been dreaming about holding conclave Goa. She went to jump from Manipur to Dr. Sulfi, who has joined from Kerala. I can see many of our national leaders, Shankul is there, Shramtas, not just they become a member, but their concerns are program. And let me also thank our national president and our national secretary, HSG madam. She always says yes to everything concerning JDN and I think to MSN also. So such is her passion for the youth. And madam doesn't agree to participate in too many programs, but I just sent her an invitation once she had.
All of us, Dr. Nayak sir, HSG madam, Dr. Datta madam, when we are in medicine, we have a very shielded life. We, our hospital, our teachers, and our friends in the medical colleges, and this bonding which is going to be there is going to be there in the future. So there are a lot of things, lot of issues which are there. I think the National President and HSG Madam will talk about those issues. Is one thing which is very close to my heart, which I would like to just take 2 minutes to talk. More and more we are seeing the youngsters being affected, may it be students, may it be the young doctors, whatever it is. I know life is tough, competition is tough, no doubt. But I think you make use of, I think even JDN has even started in all the states. MSN has started in all the states where we have the mental health committees which are over there. I know a few things you cannot talk with your parents, you cannot talk with your brothers, sisters, but definitely you can talk with your brothers in arms who are with you, sitting with you. And that is where you have to open up. Because everything can be solved in life, remember, there is nothing that cannot be solved. So this is one issue as far as the youngsters is concerned, which is very close to the National IMA, very close to my heart also. And
years. That is what we discussed and we resolved it in sometime in I think 2022 Allahabad conference, that it should be like that. And that is how the membership is increasing day by day. We know that future of medical education is going through a very difficult, very rough patch, but IMA Maharashtra has been always standing. In fact, we have only fought with the homeopathic matter in the mixopathy. I think myself, Dr. Utture, and our friend, I think in the court that time when the hearing took place. Now the hearing will start next week. I just got a call. So we have been fighting for the mixopathy for last 12, 13 years, and now we see that something is, people have realized, government has realized that these issues are very important. It is not just easy that allow them to practice homeopathy, doctors to allopathy. Anyway, we will be fighting and taking care along with the mix.
शिवाजी छत्रपती शिवाजी महाराज जयंती. आज छत्रपती शिवाजी महाराजांची जयंती आहे. And today you have organized this particular very important conclave in Maharashtra. Yes, definitely you will get a success in future. Because स्वराज्याची स्थापना ज्यांनी केली त्या भूमीत तुम्ही घेताय, मराठी बोलल्याशिवाय होणार नाही. म्हणून हे वाक्य मराठीत बोलावंच लागते. छत्रपती शिवाजी महाराजांच्या जयंतीच्या दिवशी तुम्ही या कॉन्क्लेव्ह बोलवला, so you will get a success in it. But n number of hurdles are there, n number of challenges are there. If you go retrospectively, if you go prospectively, you have to carry out a survey. You have to see the scenario of UG, how much is the input nationally? Unless and until you will not see this particular 40 सा दिल है अनिल भाई का और परायों को अपनों को सबको समा लेते हैं. इनकी तारीफ हम छोटे आदमी क्या करें, बड़े बड़े लोग इतनी तारीफ कर चुके हैं अनिल भाई की. ये हमारे नेता है, यही मालूम है कि ये नेता यहाँ पे नहीं रखने का उनको, ये वर्ल्ड मेडिकल एसोसिएशन के अध्यक्ष बनाना है. Unless and until you will not give this particular strength to Dr. Anil Naik, it is very difficult to get a united our IMA. So this particular thing we must actually, such type of great leader we got. So thank you sir. आज के दिन आप महाराष्ट्र में आए, दत्ता मैम बहुत अच्छा दिन है और wish you all the best. Thank you for giving me an opportunity to say few words before you. Thank you. Jai IMA, Jai JDN, Jai.
Thank you, Doctor. Also, we sincerely appreciate your proactive role in the PIL regarding removal of the medical profession from the ambit of the Consumer Protection Act. Sir, it is indeed a privilege and an honor for us to have you amidst us today. At a time when our profession faces regulatory, legal, ethical and societal challenges, your dynamic leadership has provided clarity, direction and unity. Under your able leadership, the initiative for building donation for the IMA headquarters at Delhi has inspired members across the country. The headquarters is not merely a structure of brick and mortar. It symbolizes the strength, solidarity and stature. The visionary program Aao Gaon Chale has taken the healthcare to the grassroots, encouraging doctors to serve rural India where accessibility remains a major need. Several branches including Amravati, Akola, Yavatmal, Mira Bhayandar, Chhatrapati Sambhaji Nagar, Mumbai and Mumbai West are regularly conducting such activities. Your support in our legal fight against cross-pati has encouraged us immensely. Protecting modern scientific medicine is our responsibility towards patient safety. Our CCMP case is currently under hearing with Advocate Kamdar representing us and we are hopeful for a positive outcome. Like Lele sir said, next week we have the dates. I take this opportunity to sincerely thank Patron Dr. Ketan Desai sir, Advocate Bajaj sir, Dr. Naik sir, Dr. Uttre sir and Coordinator Dr. Jayesh Lele sir for valuable help in the case. We are extremely delighted by the gracious promote healthier lifestyles. I congratulate the
respected Dr. Anil Naik sir, President IMA, Dr. Sarvi Datta Madam, Secretary General, Dr. Jayesh Lele, former Secretary General IMA Headquarters, Dr. Uttre sir, Shiv Kumar Uttre, Chairman IMA MSN, Dr. Indranil, Dr. Srijit, Chairman IMA JDN, Dr. Rashmi, President IMA Mumbai West, all other respected dignitaries sitting on the dais, all the dignitaries sitting off the dais. Excellent work done by the IMA Junior Doctors Network under dynamic leadership of Dr. Srijit, whose chairmanship has given JDN a clear direction, strong voice and renewed momentum. Also, I acknowledge the work done by the Vice Chairman Dr. Thakur Padmanabh, just not a wing of IMA, but one of the strongest pillar of the IMA. Dear friends, IMA have always believed that junior doctors are not just members, but the future backbone of this greatest organization. IMA is just not an organization. It is a family. It is a family of more than 4 lakh doctors across the nation, plus more than 1 lakh JDN and MSN members across the nation. It's a big, big family headed by our dear President Dr. Anil Naik. You are the thinkers, the fighters, and the torchbearers of the ethical and modern medical practice in India. And collective strength in brief. So dear friends, IMA Junior Doctor Network, the strongest pillar of the IMA today under the dynamic leadership of and vision of Dr. Siji, and JDN has the strengthened junior doctors representations to have this building in Delhi. And about the donation, as few of our colleagues have said, we can always collect the donations from big pharma industries and big hospitals. But our leadership has decided to collect donations from each and every member of the association, and now we have also included JDN. This thing will give a sense of pride, a sense of belonging, a sense of अपनापन कि हाँ ये बिल्डिंग हमारी है, हमने इसके लिए डोनेट किया है और आगे चल के ये बिल्डिंग आप सबके लिए बहुत काम आने वाली है. So with this I'll end my saying. Thank you for inviting me here. Jai IMA JDN. Thank you.
Thank you so much, Piyush sir, for your encouraging words and for graciously accepting this invitation to join this event today. Now, it is my privilege to invite the guest of honor of today's event and the first female honorary secretary.
Stress and the constant demand to perform with precision. These challenges test not only your knowledge but also your strength. But remember, only pressure creates diamonds over the years. And every difficult night duty is shaping you in a stronger clinician. Every critical case is building your confidence, and every patient's interaction is refining your...
From the entrance examination to the violence against resident doctors. We are truly grateful, ma'am. Now it is my highest honor to invite the chief guest of today's ceremony, the National President of Indian Medical Association, Dr. Anil Kumar Nayak sir, for the presidential address.
सुबह नाश्ता किया था कि नहीं किया था? Become a villain between your lunch and my speech. I will try my level best to sort it, but when there is a Youthcon and just I have finished NetCon, you might be more intelligent than me, but I have more experience than you. So I will just discuss about my experiences which I have seen during my medical, graduation, post-graduation and private practice. So just I will discuss this. Today is a historical event because West Zone Youthcon is hosted by Mumbai West branch. West and West always become best. So it is a best conference, and particularly Mumbai is the economical capital of India. Jayesh Lele, Dr. Utture, Dr. Srijit, Dr. Abul Hasan, Dr. Padmanabh Thakur. So IMA has no any competitor. But as far as JDN and MSN are concerned, many small associations are mushrooming in Delhi and in small cities. We are the students there, we are the JDN leaders. Mushrooming of the association as far as the JDN is concerned. But you are the young and spine of Indian Medical Association. JDN is the right hand and MSN is the left hand. Both are the hand of the Indian Medical Association.
So we expect, what do you want to become after passing your 12th? मैंने बोला सर डॉक्टर बनना है कि डॉक्टर तो बहुत बड़ी बात है, डॉक्टर बहुत अच्छा है, लेकिन मैं सबको बोलता हूँ, मेरे टीचर ने बोला था कि दुनिया में 2 लोगों से कभी मत बिगाड़ना। मैंने बोला कौन से 2 लोगों से? एक के भगवान से नहीं बिगाड़ना, ऊपर वाले गॉड से, अल्लाह से या ईश्वर जिसको मानते हो, ऊपर भगवान से नहीं बिगाड़ना। भगवान से बिगाड़ोगे तो डॉक्टर के पास ले जाएगा, और दूसरा है डॉक्टर से बिगाड़ोगे तो मुझे कहने की जरूरत नहीं है। तो ये मेरे टीचर ने मुझे एक ही, वी आर नॉट यूनाइटेड, सो बिकम यूनाइटेड, देन एंड देन वी विल be more strong and we can fight our problems. IMA की पहली बिल्डिंग, IMA started first conference in 1926 और 28 में उनका रजिस्ट्रेशन हुआ. It was registered in 1928. So after registration, our centenary celebration will be 2028. 200 rupees, 200 rupees, 200 rupees, 200 rupees to build this building. Then we are asking for 1,000 per member. 1,000 कहाँ से लाएंगे? आपका तो स्टाइपेंड लाख रुपया है. हम इंटर्नशिप में थे, हमारा स्टाइपेंड पर मंथ 900 रुपीज था. 900 रुपीज स्टाइपेंड था हमारा. 82 में हम MBBS करते थे, पर मंथ 300 रुपये मेरे फादर देते थे. 300 रुपीज पर मंथ, उसमें हमारा चलता था. आपका तो स्टाइपेंड लाख रुपया हो गया, और उसमें हम 1,000 मिनिमम आपसे मांग रहे हैं. अब आपकी अकेली यंग जनरेशन की बात नहीं है. IMA मेंबर, डॉक्टर्स आर मीजर कंजूस. चमड़ी टूटेगी, दंडीवड़ी नहीं टूटेगी. पैसे देने में नंबर 1 कंजूस बोलते हैं, मीजर. 1 नंबर के पैसा देने वाले कहाँ है? पैसा कहाँ है? दे लिव लाइक अ पुअर एंड डाई लाइक अ मिलियनर. सब बैंक में रख के मरते हैं. करोड़ों कमाते हैं लेकिन बैंक में रख के मरते हैं. अरे यू शुड नो द नेचर्स लॉ. कुदरत का नियम कोई डॉक्टर पहचानता भी नहीं. बारिश गिरती है, पानी कहाँ जाता है? डॉक्टर उधर राइटली सेड, वंस यू वर्क विद द यंग यू विल बी रिमेन यंग. सो आई वांट टू मेक माई सेल्फ यंग. It was 3.30 lakhs. 3.2 lakhs of members. Now it is more than 4 lakhs. And I expect, because input, as Dr. Luge rightly said, every ईस्ट से निकलेगा और नॉर्थ ईस्ट से निकलेगा. सभी जगह का आके दिल्ली में मिलेंगे 1 महीना के बाद. डॉक्टरों को कम्युनिकेट करेंगे और एक बिग चेन बनेगी. इसका भी प्लान हम कर रहे हैं. Recent IMA prizes and also youth. I recently, why I am inviting in cyclotron, how many are doing regular exercise for 30 minutes? कितने लोग सुबह 30 मिनट कसरत करते हैं? और आपको मालूम है कि असॉल्ट ऑन डॉक्टर इज द मेन प्रॉब्लम. आज हॉस्पिटल में डॉक्टरों को, नर्स को, सबको मारते हैं कि नहीं करते? असॉल्ट होते हैं कि नहीं होते हैं? बच्चियों, आरजी कर में बाहर से आके अपनी रेसिडेंट डॉक्टर की जान ले ली, रेप कर दिया, हुआ कि नहीं हुआ? तो आप मार नहीं सको तो मार खा सको, इतना तो बॉडी बनाना पड़ेगा ना. तुम्हें एक थप्पड़ पड़ेगा और मर जाओ. वेरी गुड, सबको सिखाओ. तालियां तो तुम टोल टैक्स के बाद सब खड़े होते हैं, तालियां लगाएंगे, तालियां की चिंता नहीं है. सिटी आना चाहिए. यंग जनरेशन किसको बोलते हैं? बेस्ट सिटी बजाने वाला अमिताभ बच्चन है, अक्षय कुमार है, और लेडीज में माधुरी दीक्षित है. आपको उनको कॉम्पीट करना पड़ेगा. और लेडी के लिए तो खास, कोई आप अकेली जा रही हो, कोई सामने से लुक्खा आ गया, आपको स्विमिंग आना चाहिए, आधा घंटा कसरत करना चाहिए. मुझे यंग जनरेशन के, आप पढ़ने वाले हो, 8 घंटा मेडिकल का पास कर रहे हो, एंजॉय कर रहे हो. दैट इज माई मैसेज टू एवरी यंगस्टर्स. लास्ट HPV वैक्सीन I have declared during my speech, परिवार की बच्चियों को between 9 to 14 years को दे. प्लान कर रही है इसको नेशनल प्रोजेक्ट में. उसका पायलट प्रोजेक्ट भी लॉन्च हुआ है. लेकिन हमें भी काम करना है. तो HPV वैक्सीन के लिए रिसेंटली सुप्रीम कोर्ट मेंस्ट्रुअल हाइजीन के बारे में बोला गया है. साल बिगाड़ के अपने पूरे जिंदगी के यंगस्टर्स बिगाड़ के हमने MBBS से हम सेफ है. बाकी के पोस्ट ग्रेजुएशन नहीं मिले तो ये सब वे है टू बिकम IAS, IPS, IRS, मेनी पावर भी होगा. आप क्लिनिक खोल के 10 दर्दियों का भला कर सकोगे. आप कलेक्टर बनोगे तो पूरे जिले का भला करोगे. आप DSP बनोगे तो पूरे जिले का भला करोगे. 1, 5, 10 नहीं, अपने लिए नहीं, समाज के लिए भी अच्छा एजुकेटेड डॉक्टर IPS, IAS होगा, समाज के लिए भी अच्छा है. अभी हमने नेटकॉन में गुजरात के 52 डॉक्टर्स जो IAS और IPS है उसका फेलिसिटेशन किया था. सबको मिले कि आप आए. आपका हौसला बुलंद बनाए, आप भी स्ट्रांग बनिए और IMA के स्ट्रांग.
डॉक्टर शिव कुमार उत्तुरे सर, डॉक्टर KM अब्दुल हसन सर, Dr. Kanhaiya Kumar, State Secretary. Dr. Rahul Anand. Dr. Rahul Anand. Dr. Madhubala Chinsalkar ma'am. Dr. Madhubala ma'am. Dr. Parth Pannase.
Dr. Chinmaya Sahu.
Dr. Shrijit Kumar, Joint Secretary IMA Headquarters Dr. Vasant Longde, National Chairman IMA MSN Dr. Shiv Kumar Uppure, Immediate Past President IMA Maharashtra State Dr. Santosh Katal, Honorary Secretary IMA Maharashtra State Dr. Vikrant Desai, Honorary Treasurer IMA Maharashtra State Dr. Amol Gitte, State Chairman IMA JDN Dr. Rajesh Dere, State Chairman IMA MSN Dr. Ravindra Putte, all the JDN dignitaries, National Secretary Dr. Indranil Deshmukh, State Convener IMA JDN Dr. Tithi Banerjee, and State Secretary IMA JDN Dr. Kanhaiya Kumar. And
the time management. And we'll try to cover up my concept of thinking in 20 minutes. So, many times we feel depends. So, most of the things which I'll discuss today, I am sure everyone sitting in the hall knows them well. It is just a recollection. It is just a थोड़ा जोर डालने वाली बात है सबके दिमाग के और दिल के ऊपर और अपने आप को झंझकोर by 12. But I remember I used to sit there till 2:30 and 3. No time limit. Then ward duties, it is not in your hand. You have 15 patients in the ward or 25 patients, it is not in your hand. Then rounds and documentation. One very important thing which has come issues, documentation has become very important. And in case any patient goes for any lawsuit, it is only the documented facts that are checked. Nobody checks how much effort you have done. But whatever you have documented, that will be considered. Then emergency calls can come. I have to push it on the WhatsApp, Instagram, Facebook. Then documentation and all that. And after all of this, no energy left for the studies. So why time management is critical? You know, why after all we want a time management? So that we can treat our patients well, with cool and calm mind. We have less stress and burnouts. We got more time for the more free time, more clean time, more tension-free time for our PG studies and NEET exams. You have to take your rounds. You have to attend OPDs because you are in job. You are not at home. Then we should give time to our studies, because it is only after studies we can clear our NEET exam, NEET PG exam. And what can wait? WhatsApp scrolling, social media scrolling, movies or gossiping, etc. That can wait. Most of the times we spend in the college. I have also passed from the college. Most of the times we just we are always in hurry. बॉस ये काम नहीं हुआ, वो काम नहीं हुआ, ये भी करना है, वो भी करना है. सडनली किसी ने बोला कि चल चाय पी के आते हैं, बहुत टेंशन हो रही है, चलो चाय पी चलते हैं. And that half an hour, 45 minutes is gone. You never scheduled for that. You never planned for that. So, time blocking. We have to block time for each and every important activity of the day. Hospital block, we have to have a study block time. We have to block time for say 30 minutes, 1 hour, 2 hours, 3 hours. And consistency is the key. If we have blocked 2 to 3 hours per day for study, we have blocked. Then, personal life. It reminds me one of my, college days time, one of my friend of Thakur, he was a very good person. And after the classes, he used to enjoy life. चलो यार खेल के आते हैं, बास्केटबॉल खेल के आते हैं, चलो कॉफी पी के आते हैं, चलो आज पिक्चर देख के आते हैं. अब रात को 11 बजे आ रहे हैं हम लोग, उसके बाद तो मतलब नेचुरली इतना एनर्जी रहता नहीं, बट वो इतना पक्का था कि रात को ना 12 It is the only way you can manage your time. Otherwise, if you plan to do 4, 5, 7 works in the morning, you will end up only 2, 3, 4 works. Because fixing is not there, time allocation is not there, and most of the time you are stuck in one work, other 2 works might be forgotten. It happens with me. I don't know with you all. So, try to have a pocket notebook. Then you can record your discharge summaries work or patient list work in the night only. Then study time management. आपको कभी पीजी शिप में जब आप जॉब कर रहे हो लंबा टाइम तो मिलेगा नहीं, 4-6 घंटे पढ़ने का. If you are in active hospital practice, what we can do is कि जब भी टाइम मिले 20, 30, 40 मिनट का, we should start studying. अपने हाथ में अपना सामान रखिए. आजकल सबके फोन में लेक्चर्स होते हैं, नोट्स होते हैं, और 20 to 30 मिनट्स यू कैन इन बिटवीन जहां मौका लगे वहां पे अपना पढ़ लेना चाहिए. और एक गोल बनाना बहुत जरूरी है. एवरीडे गोल, वीकली गोल, मंथली गोल. मोस्ट ऑफ द पीपल इन एवरी प्रोफेशन they move around without any goal. भागे चले जा रहे हैं बस, कोई एंड पॉइंट नहीं है. मैं भी करता हूं ऐसे. We should fix our goal कि हमें एक हफ्ते में इतना तैयार कर लेना है, और उसमें भी एक हफ्ता 7 दिन का नहीं होता, एक हफ्ता 6 दिन का होता है. 7वें दिन जो छूट गया उसको आपने कवर करना है, अदरवाइज छूट ही जाएगा. तो गोल मेकिंग इज वेरी इंपॉर्टेंट. And try to do this consistently. Always talk to your friends and colleagues. Always share your issues. Always share your problems. Nowadays, it is WhatsApp message is there that we have hundreds of friends on the digital media, but 2 or 3, not even 2, 3 friends in the real media. Always try to open up your friends. Always take their suggestions. Always tell your thing. That will lighten up your burden. That will ease you up. And always take a weekly break. It is not necessary if you are taking a break, you are going to an expensive restaurant or you are going to some expensive all wins. That is one very good thing. आपने एक चैप्टर कंप्लीट कर लिया, याद कर लिया, celebrate it. Might be it is not necessary कि सेलिब्रेट करने के लिए आपको बाहर जाके कुछ खा पी के आना है, घूम के आना है. यू कैन सेलिब्रेट, चलो यार मैं 10 मिनट आज गाना गाऊंगा, मैं ये मेरा सेलिब्रेशन. 15 मिनट किसी पुराने दोस्त से बात करूंगा, दैट कैन बी सेलिब्रेशन. और कोई बड़ा अचीवमेंट है तो यू कैन सेलिब्रेट अकॉर्डिंग टू यू. हम लोग काम करते करते इतने मशीनी हो गए हैं कि कोई भी काम की खुशी कंप्लीट होने की हमें खुश नहीं करती. When I started my practice in 1996, hepatitis B vaccine was just launched in 1996. GST का वैक्सीन आता था. One vaccine was costing to doctors around 155 rupees. MRP was 255 rupees and my consultation was 100 rupees. So I used to charge 350 rupees. 155 rupees was MRP, 350 was selling price. जिस दिन शुरू में जब एक या कभी 2 इंजेक्शन लग गए उसने, इतना खुशी होती थी कि बॉस और 2 इंजेक्शन लगाए हेपेटाइटिस बी के हमने पेशेंट को, मजा आ गया. और अब हम 10-10 लगा लेते हैं, फर्क ही नहीं पड़ता. ठीक है यार, 10 तो लगाए हैं, ओके. सो ऑलवेज ट्राई टू सेलिब्रेट योर सक्सेस और स्मॉल विन. One of the very important things which is never taught in our medical colleges, and we doctors are very, very fissati on this aspect, is the financial wellness. We never know what the financial wellness is. I never knew what is the difference between a share or mutual fund during my internship or house job. I am telling you the truth. And few of my friends, बहुत आज ये शेयर लिया है, आज ये म्यूचुअल फंड में अप्लाई कर रहे हैं, देख रहे हैं, अब पता नहीं यार क्या बातें करते हैं, पता नहीं. और उस टाइम जब ये हमें समझ में आया बाद में कि यार इन्वेस्टमेंट भी कोई चीज होती है, तब तक काफी टाइम निकलना शुरू हो जाता है. कॉर्पस इकट्ठा करना, इसे पैसे को कैसे इन्वेस्ट करना है, कैसे खर्च करना है. मेरे सामने सीनियर डॉक्टर्स बैठे हैं, डॉक्टर उत्तरे और डॉक्टर अनिल. हम डॉक्टर्स क्या करते हैं, जब पैसा इकट्ठा करते हैं तो कोई जमीन खरीदने की कोशिश करते हैं, या अपने पास रखते हैं, कोई दोस्त मांगने आता है उसको दे देते, चल ले जा. और जिस दिन उस डॉक्टर ने वो पैसे वापस नहीं किए, तब आप कुछ कह नहीं सकते उसको. फिर आप घर बैठ के मतलब ग्रिल करते हैं अपने आप. आज का टाइम काफी चेंज हो गया है. आज का टाइम काफी चेंज हो गया है. देयर सो मच ऑफ नॉलेज ऑन इन्वेस्टमेंट. आपको गोल्ड में इन्वेस्ट करना है, गोल्ड खरीदना नहीं है, 1,50,000 का 10 ग्राम है, वो तो मिलेगा नहीं. बट यू कैन इन्वेस्ट इन गोल्ड बॉन्ड. वो शेयर्स खरीदते हैं, शेयर्स बेचते हैं. आपको जो मेहनत करनी चाहिए वो आपको नहीं करनी पड़ती, वो करते हैं, थोड़ा पैसा लेते हैं. एटलीस्ट आपका जितना भी आप सेव कर सकते हो 10 to 20%, कुछ नहीं है तो 1,000 रुपए, 2,000, 5,000. आपका 1 लाख का स्टाइपेंड है, 5,000 रुपया कुछ नहीं होता उसके अंदर, नथिंग. लेकिन वही जब आप 3, 4, 5 साल इकट्ठा कर लेंगे, तो वही जाके जब 2, 3, 4 लाख होगा, यू विल फील हैप्पी. एंड यू शुड बी अवेयर अबाउट दिस. लास्ट एग्जाम्पल दे रहा हूं. मेरी डॉटर है, एमडी पीडियाट्रिक्स किया उसने, 1.5 साल पहले खत्म किया एमडी पीडियाट्रिक्स. उसको मैं बोलता रहता हूँ शेयर्स के लिए तुम ऐसे कर लो, ये ऐसे कर लो. वी हैव गॉट अ ट्यूबुलर रीजन. हमारे जो डॉक्टर होते हैं हम लोग, हमारे ट्यूबुलर जैसे वो घोड़े के ऊपर लगा देते हैं ना पट्टी, यहाँ पे इधर देखे ना उधर, वसीला सामने देखेगा. वी डॉक्टर्स आर ट्यूबुलर रीजन. हमें बस अपनी मेडिसिन का पता है, कुछ पता ही नहीं बाहर क्या हो रहा है. और जो स्पेशलिस्ट हैं उनको अपनी स्पेशलिटी के बाहर का नहीं पता. शी इज अराउंड 28 years. माई यंगर डॉटर इज 22 years. शी जस्ट फिनिश्ड बीटेक फ्रॉम NSUT कॉलेज है दिल्ली में. लास्ट ईयर खत्म किया उसने. उसके बाद उसका एक फाइनेंशियल फर्म में जॉब लग गया. शी इज 22.5 राइट नाउ. शी हैज रिटन 2 books फॉर चिल्ड्रन. शी इज ए ग्रेट भरतनाट्यम डांसर. देन शी रेगुलरली कम्स एंड आस्क मी एवरी फ्यू डेज कि पापा आपने इस शेयर में क्यों इन्वेस्ट किया हुआ है, उसमें क्यों नहीं करते हो, पापा म्यूचुअल फंड में इन्वेस्ट मत करो, पापा एफडी में पैसा मत लगाओ. सी द डिफरेंस. क्योंकि उनको जो बीटेक वाले लोग हैं या उनके जो सर्कमस्टांसेस है, वहां शुरू से उनको हर चीज पे. सो जस्ट टू फाइनल टेकवे, डू नॉट प्रोक्रेस्टिनेट. टाल बटोरी ना करें. प्लान योर डे प्रॉपरली, प्रायोरिटाइज एंड शेड्यूल, बी ऑर्गेनाइज्ड, take help from others, work smart. use AI and other digital media help. जहां possible हो वहां पे AI की help लें, डिजिटल मीडिया के टूल की हेल्प लें. That will definitely help. बहुत लोग घबराते हैं AI से कि AI आएगा तो हमारी जगह खत्म हो जाएगी. डॉक्टर्स की जगह कभी खत्म नहीं होगी, लेकिन जो लोग यूज नहीं करेंगे AI वो जरूर पीछे रह जाएंगे. Learn to say no. Always a very good point. Learn to say no. जहां पे भी आपको लगता है कि आपके कुलीग, फ्रेंड्स, रिश्तेदार, कोई भी आपका टाइम खराब करने के लिए कह रहा है, आप यहां चलो, वहां चलो, say for restrictions and stay healthy. A famous motivator speaker, Peter Drucker, has said, until we can manage time, we manage nothing else. So let us respect our time, sharpen our skills, and become better doctors every day. Thank you.
Thank you, Dr. Piyush sir. I consider myself also a young doctor, and I have learned a lot from this. It's not only for the residents. I think all of us need proper guidelines on time management, and definitely this has been helpful for all of us.
I would just like to add one thing. All young doctors, please take out half an hour, 30 minutes for yourself. In morning, do some meditation and think what you plan to do today and what you had missed yesterday and how you want to go today. Thank you.
Thank you, sir.
Now to express our gratitude and appreciation, may I respectfully invite our chairperson, Dr. Rashmi Mehta ma'am and Dr. Padmanabhan Thakur sir to kindly come forward and felicitate our esteemed speaker, Dr. Piyush Jain sir, as a token of our admiration and thanks. I request Dr. Mukesh Bhatia sir to kindly come on the stage and felicitate our honorable chairpersons, Dr. Rashmi Mehta ma'am and Dr. Padmanabhan Thakur sir.
All the people who are taking part in the quiz, please come to the front.
Yes, I'll announce that just a minute. It's now time for one of the most exciting segment of Youthcon 2026, the Pulse Check competition. To conduct this dynamic academic challenge, I have the honor of inviting Dr. Mukesh Bhatia sir to the stage. Let's have a big round of applause for Dr. Mukesh Bhatia sir. He is the chairman and managing director of Dr. Bhatia Academy, a premier institute known for training aspirants for USMLE, NEET PG, NEET SS, MRCP, and many more since 1996. He has taught complete medicine to more than 3 lakh students and has recorded over 400 hours of comprehensive medicine lectures.
an awardee of the Lifetime Achievement Award by IMA and the Delhi Medical Association. His contribution to medical education is truly remarkable. Sir, we welcome you to lead the pulse check competition. I now request all the participating teams to kindly come forward and take your respective positions on the stage. Let's give them a big round of applause as they gear up for this academic face-off. Come on guys, everybody should come ahead. All the participating teams, grab your position right now. We check. Barely in scrubs, Brinda Sharma and Nishchita Bandekar. Trailblazers, Abdul and Mohammad Usmair. R&T, Rohit Rajan, Trupti Patil. SNOD, Shreya Singh, Anjali Agarwal. Preventive Pulse, Pranav Patil, Shreya Dev. Sit according to your teams, no worries. One team is missing, is barely in scrubs here. Trailblazers is missing. 2 degrees, R&T, SNOD, Preventive Pulse, great. So the stage is yours.
Well, without wasting any time, thank you very much for giving me a chance. Okay. Welcome to all of you. And thank you very much for giving me a chance to the conductor quiz. I have done this. Marking nahi hai. ठीक है? With this we start. All questions are from NEET PG and ICT, and it will be a good learning experience for you. Next slide, please. Well, learning with entertainment is my way of teaching. I speak for 10 hours, कोई बंदा सोता नहीं, nobody can sleep. I don't let anybody sleep. Next slide, please. चलिए, आप सब थक चुके हो?
Get ready, guys.
Yes. इससे पहले कि मैं शुरुआत करूं, ये हमारी पहली मुलाकात है, तो इस बात पे एक शेर अर्ज है. इरशाद बोलते हैं, इरशाद.
इरशाद.
अरे जोर के बोलो ना, इरशाद.
इरशाद, इरशाद.
Learning with entertainment. कुछ नशा धीमी बरसात का है, कुछ नशा तेरी बात का है, कुछ नशा धीमी बरसात का है, कुछ नशा तेरी बात का है. तुम यूं ही हमें शराबी न समझो, तुम यूं ही हमें शराबी न समझो, ये असर मेरे दिल पर तेरी पहली मुलाकात का है.
वाह वाह वाह, क्या बात, क्या बात.
तो दोस्तों, learning with entertainment is my way. Next slide, please. Next slide. Next. Question 1. So, team 1. You are from which college? नाम बताओ अपने.
मेडिकल कॉलेज.
अच्छा, और करते फटाफट माइक आगे दे देंगे आपको, ठीक है? चलिए. ओके. Question 1. या. इसके लिए आपको you get 30 seconds. कोई पास नहीं है, नो पास. क्विकली. या. चलो, टाइम एंड. चलो, अब बाकी लोग सिर्फ कितने लोग नो मार्क्स, कितने लोग ए वाले हैं, बी वाले, सी वाले, डी वाले. वेल, नेक्स्ट स्लाइड प्लीज. द आंसर इज इंफीरियर वॉल एमा. इंफीरियर वॉल. लेट्स लर्न लीड्स कैसी कैसे होती हैं. इंफीरियर वॉल का 2, 3 AVF. लेटरल का एंट्रोसेप्टल V1, V2, V3 और लेटरल वॉल में L1, V4, V5, V6 एंड AVF. तो दिस इज एवरीबॉडी शुड नो. ये आपके फाइनल ईयर में प्रैक्टिकल में ये चीज जरूर आएगी. हर एक को आती है, पेपर लिख रहा हूं लेकिन ईमानदारी से. नेक्स्ट स्लाइड प्लीज. क्वेश्चन 2. तो इनको नंबर नहीं मिले. टीम 2 कहाँ के हैं हम लोग? विच कॉलेज?
नायर हॉस्पिटल.
नायर हॉस्पिटल. और देख के बाइक आगे कर देंगे. या हाँ, सवाल और, उसमें कोई मार्क्स नहीं है। जनरल फास्टिंग का एक क्राइटेरिया 126, तो बीपी का कितना होता है, हाउ मच इज सो कॉल्ड मोर देन हाउ मच रैंडम शुगर इज डायबिटीज 200। तो याद क्या सीखा, फास्टिंग 126 है और रैंडम ले है 200 से ज्यादा है, तो इट इज डायबिटीज। एक और सवाल, there are 3 criteria to diagnose diabetes, fasting का 2 घंटे वाला, HbA1c. HbA1c should be more than how much to diagnose diabetes? 6.5. तो आज आपने सीखा how we diagnose the case of diabetes. ठीक है, चलिए नेक्स्ट स्लाइड प्लीज। तो इनको 10 नंबर मिलेंगे, स्कोर लगाऊंगी। ओ ये पहले वहां पर, ठीक है ना, चलिए तो राइट। हाँ, टीम 4 या आपके लिए नेक्स्ट स्लाइड क्वेश्चन, impaired glucose tolerance.
D option.
Option B, random sugar more than 200.
Option D, 2
D,
hours.
ये वाला श्योर कॉन्फिडेंट। कितने लोग ए वाले हैं, कितने लोग बी वाले हैं, कितने लोग सी वाले हैं और कितने डी वाले हैं। वेल नेक्स्ट स्लाइड प्लीज। गिव देम 10 मार्क्स। अगर आपने जीटीडी किया और यहाँ पे 2 घंटे बाद ये वाली वैल्यू आ रही है, फास्टिंग 11 to 126 है, तो आउट ऑफ ऑल द ऑप्शन दिस द मोस्ट बेस्ट ऑप्शन। ठीक है, इम्पेयर्ड ग्लूकोज टॉलरेंस वी कॉल इट। नॉर्मली आजकल जीटीडी करते नहीं है, क्यों जरूरत नहीं पड़ती है, ज्यादातर कोई वी कैन डायग्नोज अदरवाइज। चलिए एक और सवाल, नो मार्क्स। मे बी द फर्स्ट प्रेजेंटेशन ऑफ टाइप 1 डायबिटीज समझागी, तब उसको वेटी करेंगे। एक और सवाल, टेल मी वन ऑफ द मोस्ट कॉमन प्रेजेंटेशन ऑफ डीके क्या है, मोस्ट कॉमन प्रेजेंटेशन किससे आता है? लिटिल है, well she said fruity, this thing I appreciate the answer, give a big hand to her। ये सही नहीं है, but आपने आंसर दिया I appreciate। yes, anybody else can try। ऐसे नहीं, एक हाथ खड़ा करो यार। अरे वही का प्रेजेंटेशन क्या है, this how patient come to us, yeah, small breathing, ठीक है, वैसे the most common is vomiting and pain down। At times it is mistaken as gastroenteritis, something like that, food poisoning टाइप का होता है। तो ये और पेन ऑफ। अब एक और सवाल, दिस इज ए रैंक 1। सी ये वाला, ठीक है। कितने लोग ए वाले हैं, कितने लोग बी वाले हैं, सी वाले, डी वाले। वेल राइट आंसर्स आगे चलेंगे। मैं एक चीज आपसे कहूंगा, सभी लोग हाथ खड़े करेंगे, या तो आंसर सही है गलत है, सही है अच्छी बात है, गलत है तो और भी अच्छी बात है। क्यों? आपने कुछ सीखा, फिर जिंदगी भर याद है, अरे यार ये मैंने गलती की थी, अब गलती नहीं करेंगे। तो दोस्तों अगर अगेन कम बैक टू क्वेश्चन, अगेन सवाल दोहराओ। ओबीस माइल्डली रेज ब्लड शुगर, ओबीस है माइल्डली रेज शुगर है, 2 बार 3 बार चेक कर लिया, ठीक है। तो पहले डाइट एंड एक्सरसाइज चाहिए। गॉट इट? अगेन माइल्डली डायबिटीज है तो लाइफस्टाइल मॉडिफिकेशन इज द फर्स्ट। ये आपको सभी को, ये लाइन आपको एग्जाम में, हर एक एग्जाम में आता है। लाइफस्टाइल मॉडिफिकेशन में क्या क्या आती है? वेट, बीपी और अपना कोलेस्ट्रॉल, स्टॉप स्मोकिंग, अदर फ्यू अदर पैरामीटर, एक्सरसाइज वगैरह, ये लाइफस्टाइल मॉडिफिकेशन में आता है। Stop smoking, control lipid, control BP. Why? They are the major risk factor for coronary artery disease। 4 हैं, कौन कौन से हैं? स्मोकिंग, हाइपरलिपिडीमिया, डायबिटीज एंड हाइपरटेंशन। ये लाइन 4 वर्ड आपको आपके फाइल प्रॉफ में कहीं ना कहीं जरूर काम आएंगे। मेजर रिस्क फैक्टर। नेक्स्ट लाइन प्लीज। डाइट एक्सरसाइज, नेक्स्ट लाइन। अच्छा, टीम 1 तो आपको ये आ गई, और डायस्टोलिक बीपी नॉर्मल होता है। तो वी कॉल एज ISI, आइसोलेटेड सिस्टोलिक हाइपरटेंशन, एंड दिस इज ओके। नाउ पहली बात यह है कि इन पेशेंट में ओनली सिस्टोलिक बीपी हाई होता है, अब आते हैं गोल्ड मेडल क्वेश्चन. Why systolic BP is raised? Why? What's the reason? What's the basic pathophysiology behind that? Who can answer? Because of what? Yeah. Give a big hand to him. It is the arteriosclerosis, not athero. Till the media become calcified, thick होती है, and that's why only systolic BP high. I hope you all know. Systolic BP is governed by the elasticity of the artery. Diastolic is governed by the peripheral resistance. Good, very good. Now, एक और सवाल. ये अगर आपने वाइवा में एग्जाम में आंसर दे दिया, आपका गोल्ड मेडल पक्का है मेडिसिन में. ये पेशेंट आया तो एल्डरली मैन याद रखना, कभी अगर आपके घर में ग्रैंड पेरेंट्स हों, आज घर जब जाके उनकी पल्स चेक करना, देखना पल्स कितनी है, देखना उनकी पल्स होगी कोई 50, 55, 60, तो शुड नॉट गेट वेरी अबाउट. तो एक चीज और सीखी, रूट चेक करना, उनका बीपी भी चेक करना, आर्टरी पैल्पेट करना. वो भी हैरान हो गया, क्या क्या हो गया बेटा, देख के मुझे बताना जरूर. एंड यू लर्न समथिंग न्यू. Okay, then you tell the final. Next slide, please. Question 7. It is for team 1. Team 1. Next slide. Next slide. Next slide, होता है, पर वो बहुत थोड़ा लिमिटेड और सेल्फ लिमिटेड होता है. Got it? और हम सबको वायरल फीवर साल में एक बार है. मान लो ऑडियंस में 100 लोग बैठे हुए हैं, 5 साल में 500 केस हो गए. इनमें 10% को भी अगर फ्यूचर रहा होगा तो 50 के तो यही हो गए. और टीवी किसी किसी को किसी को फीट होता है. ये बात किसी को भी नहीं पता. तो क्या सीखा? कभी भी वायरल फीवर एक्सरे दिखाए तो कीप इन माइंड. एग्जाम अगर आपने बात बोल दी, वायरल फीवर वाली बात है, गोल्ड मेडल आपका. किसी को भी बात नहीं पता. रैंक 1 क्वेश्चन बोलते हैं, इसका आंसर किसी को नहीं पता. समझाइए. पीजी एंट्रेंस में यू शुड नो मोर देन व्हाट अदर्स नो. आपके प्लस 4 होंगे. टीम टू. नेक्स्ट स्लाइड.
ओके सर. यस,
क्विकली. क्विकली. ये 1 लाइनर है, इसमें कोई नेगेटिव मार्किंग नहीं है. सही पे 10, ना पे 0.
टाइम लिमिट 1 मिनट है, अपना टाइम ले सकते हो.
टाइम लिमिट है थोड़ी 25 सेकेंड्स. टाइम ओवर. हाँ जी. एनीबडी कैन आंसर दिस क्वेश्चन?
सर, इप्राट्रोपियम.
Sorry, ipratropium, no, not answer. Anybody can answer? Paradoxical. Next slide, please. Team, कौन सी ये? 3. Team 3 है ना? Team 1, 2, 3, 4, 5 and 6. हाँ जी, बोलो. Question. Quickly.
Fatty.
Huh?
Fatty.
No. Who says? कितने लोग? हाँ, anybody can answer? Wait. Anybody from audience? I first give for the audience. Yeah. And throat close is the right answer. Give a big hand to him. जो fat जाता है, it's a macrophage aggregator, and that will the foam cell. Good. Next slide, please. And throat close it. Okay. Next slide.
Tell me any condition where there is chronic renal failure with enlarged kidney size.
Nephrotic syndrome, well, not the right answer. Never mind. आपने किया, give a big hand to him. Try to किया. आपने try to किया. I appreciate. Anybody else can try. Yeah. और कोई? हैं? Hydronephrosis और कोई? Well, पहलू नहीं है. Anyway, next slide please. Next slide. पहली बार the most diagnostic investigating for any case of CRF is bilateral contact. No negative marking, you can try.
Autosomal dominant.
Right answer, 10 marks.
Amazing, amazing.
Good. Next slide, please.
Clinical instincts on point.
Next slide, next slide. So, MODLY पे आपको एक सवाल जरूर आएगा आपके फाइनल पेपर लिख रहा हूँ लेकिन ये मानता है. Okay. The very commonly asked. MODLY पे again बच्चों में होती है just like type 1 diabetes. इसमें भी इंसुलिन कम होता है just like type 1 diabetes. No antibodies. ये वाला जो पॉइंट है differentiate from type 1 diabetes. टाइप 1 में ऑटो एंटीबॉडी होगी, इसमें नहीं होगी. यहाँ पर नो बीटा सेल डिसफंक्शन जबकि उसमें टाइप 1 में होता है. नो हाइपरटेंशन, नो वेस्टेज, ये दोनों फीचर टाइप 2 के हैं. एंड ट्रीटमेंट इज नो.
Okay. Let's move ahead.
Yeah, it is inhaled and insulin are free. Alright. Next slide.
Okay.
Next, team 2.
Team 2. When do you call a case as hypoglycemia when blood sugar is less than
70. 70. 70. 70. Audience. 70. Pakka. Sure. Confident. 54. Or we answer. Audience only for students, not for the faculty, not for seniors, only for students. Next slide, please. Next slide. 70 is the right answer.
Wow. Perfect.
10. Okay. चलिए और देखते हैं. Well, जब ये शुगर कम होती है काउंटर रेगुलेटरी हार्मोन आने शुरू. ओके, ये रैंक 1 क्वेश्चन. पेशेंट यूजली कैसे आता है? ठंडे पसीने, घबराहट, पैल्पिटेशन. नेक्स्ट लाइन.
Which organism causes malignant otitis externa?
Well, okay. Now, an audience, students, yeah. Pseudomonas, क्या कह रहे हैं? Or anybody else can try. Well, the right answer is pseudomonas. The right answer. और इसमें typically EM start होती है. Next, 3-4. Yeah.
Corticosteroid can cause acid-base disturbance in the body.
2 साल पहले आईना नीट का क्वेश्चन. नहीं
Which corticosteroid?
नहीं no. क्वेश्चन ये है स्टेरॉइड दिया what type of acid base disturbance क्या होता है? मेटाबॉलिक या नेक्स्ट होगा क्या?
So the question for the audience, the question is corticosteroids can cause which type of acid-base disturbance in the body?
Metabolic alkalosis.
Metabolic acidosis, loss of alkali acidosis. Gain of alkali acidosis, loss of acid is alkalosis. अब बंदे को वॉमिटिंग हो गया, he is using HCl, that lead to alkalosis. एक बंदे को कार्डिक अरेस्ट हो गया, लैक्टिक एसिड इकट्ठा हो गया, एसिडोसिस हो गया. CO2 is a acid bicarb with alkali. Gain of CO2 is respiratory. Whatever funga happen with CO2 is respiratory. Any funga with bicarb is metabolic. The respiratory acidosis increase CO2. Respiratory alkalosis reduce CO2. Metabolic acidosis, low bicarb. Metabolic alkalosis increase bicarb. So acid base in one. Time come. Next time. अच्छा now.
But still nobody is going to forget this now.
Plus, और इफेक्ट क्या है लॉन्ग टर्म? डायबिटीज, हाइपरटेंशन, ऑस्टियोपोरोसिस. याद है दे आर सेकेंडरी कॉज ऑफ डायबिटीज. ये चीज आपको जरूर आएगी एग्जाम में कहीं ना कहीं. स्टेरॉइड की फिजियोलॉजी में फार्मूला आएगी, दे आर सेकेंडरी कॉज. नेक्स्ट स्लाइड प्लीज. टीम 5.
Team 5.
Next. मैक्सिमम मॉर्निंग में मिनिमम लीस्ट रात को होता है. This is used to investigate to Cushing syndrome. How we use this knowledge? We check midnight salivary cortisol level. We check midnight. Yes, because normally midnight में cortisol level release होते हैं. अगर midnight cortisol का level high है, that is a very good screening test to diagnose right? Check. वैसे एक और सवाल. What is the most accurate test to diagnose Cushing disease? Cushing disease, I hope you know. A sample ACTH. Inferior total average same time. MRI is, remember, in endocrine, कोई भी imaging से we never diagnose endocrine disease. We always confirm by biochemistry. ये बात आपके दिमाग में घुल जाए. MRI the photo है. फोटो है, it may give a wrong picture. तो MRI करेंगे उसके बाद we will form inferior pedural sinus sample. क्या आंसर है? Inferior pedural sinus. Next slide. Quickly. Yeah. No answer. Anybody else can try? And one question. Next slide. All and just the right answer. Next slide. अगर रे JVP with non-pulsatile रे JVP मिल जाए तो superior vena cava syndrome है. Additional finding will be prominent upper chest vein मिलेगी. लेकिन नॉन एग्जाम में क्वेश्चन हमेशा non-pulsatile रे JVP. और ये अगर आपने वाइवा में बोल दिया आपका गोल्ड मेडल. Non-pulsatile रे JVP का सिर्फ एक ही आंसर है superior syndrome. Commonest cause is small cell lung cancer. लिम्फोमा में होता है. That means आप सिर्फ ये देख के कह जाओ कि बंदे को small cell lung cancer. Example of this syndrome. और आपका primary hypertrophic syndrome are the few causes where we can have secondary hypertension. Next question. Next.
Antidiabetic drug is contraindicated in congenital congestive heart failure. Which antidiabetic drug?
Yeah. Quickly. Okay. Audience. बोलो.
Patient is on metformin.
क्या देंगे आप? Quickly. Metformin. Not right answer, but I appreciate your answer. Anybody? Audience? Yeah.
SGLT2 inhibitor.
SGLT2 inhibitor, the right answer. Give a big hand to her. ये बात ज़्यादा लोग पढ़ी करना है. अब now SGLT2 inhibitor are in the first line treatment of a case of congestive heart. Other drugs that we can give in CHR are is ACEI. ये दो खास दवाइयाँ जो कि हम लोग we give in congestive heart. Next slide. Sugar, 5 sugar. Sodium को क्या? Quickly. Okay. Audience. पहले उनके लिए.
Anyone from the students who can answer?
Increases. Hypertension. और कोई आंसर? give a big hand. पहले बात तो I appreciate your answer. और कोई आंसर? Decreases. इसे कहते हैं pseudo hypo. Anybody मल्टीपल माइलोमा, मल्टीपल माइलोमा के अंदर हाइपर प्रोटीन है, and you can remember to हाँ यार कुछ कैसे वो बहुत अच्छी चीज है उसका ठीक है फिलहाल give a big hand to her also जहाँ भी gamma globulin पड़ेंगे to you right but usually they talk about multiple myeloma right I appreciate your answer. Next slide please. Next slide. So multiple myeloma is a VVV atrophy. ये आपके फाइनल में भी आएगा और दुनिया का कोई सा भी एग्जाम दे लो MRCP, MLE, नीट और सब में मल्टीपल मालूमों में दो सवाल जरूर पर अदर फीचर ऑफ मल्टीपल मालूम वेरी हाई PSR का दो तीन chronic renal failure with hypercalcemia. Next slide please. देखिए पेरिफेरल फ्लूइड में क्या है? पेरिफेरल फ्लूइड में क्या मिलेगा? Well, roulette formation, RBCR chip and crossing. देखते ही इसे roulette formation. Next slide please.
So there are just 5 minutes remaining for the Wi-Fi session.
2 minutes यार.
Okay, sir.
Discussion नहीं करेगा. Next slide.
Which component of lipid is involved in reverse cholesterol transport?
Yeah.
In COPD, what is the ratio FEV1 to FVC?
More than 0.7.
More than 0.7.
Since it is obstructive disease, so
More than
FEV1.
0.7. Well, next slide please. I'm sorry.
Sorry.
I'm sorry. नहीं सीखा आपने अब जिंदगी में नहीं गलती करेगी हम यहाँ नंबर लेने के लिए नहीं बैठे गलतियां सुधारने के लिए आपको आंसर आता है और आप गलती करेंगे क्योंकि आपको जल्दी थी ना 5 नंबर का फर्क पड़ गया 4 + 1 मिनट एग्जाम के बाद पता लोग क्या करते ओ यार इसे मैं कहता ओ यार सिंड्रोम याद रहे तो 3 प्राइमरी कैल्शियम चैनल डॉक्टर है filter that X primary of the coronary artery. That's why this is coronary artery primary. The rapamil is primarily acting on the connection or filter that of coronary. FDP is for peripheral artery. Next slide. Read index. Read index. Here rank 1 question. In 99% of the artery. Quickly. Audience. पहले audience के पहले audience. अब हम तो किसकी बात करें? कौन एक बुक का जो राइट आंसर give it a hand to them but no marks. Next slide. ये read index है. Mucus plus. Not the right answer. Give it a hand. Audience. Hyperkalemia, right answer. Give a big hand to him. Hyperkalemia. That's why we do not give you the next time. So, and one more thing. Common side effect of ACI cough and both danger is और एक और है first group. Next slide please. No, next slide. Next slide. आपको इसमें से एक सवाल जरूर आए कौन से भी कौन बात है द लॉन्ग एक्टिंग आर लार्गिन डिटरमिन डेली है और शॉर्ट ब्लू लाइसिस इज पार्ट ऑफ द अल्ट्रा शॉर्ट. नेक्स्ट स्लाइड.
Pheochromocytoma.
Right answer, give a big hand to him. Next slide. Hyperthyroid and flu दोनों में थोड़ी हाइपरटेंशन होता है. तो कैसे डिफरेंशिएट करेंगे? इसके अंदर पोस्टल हाइपोटेंशन होता है, इसके अंदर नहीं. ये रैंक 1. PO के अंदर next slide please.
Team 3.
बहुत नई चीज आई है, ये ऑटो को 1A 1B भी आई, 1B में क्या है? वहाँ भी बीटा सा डिस्ट्रक्शन होता है कि ऑटो एंटीबॉडी नहीं होती है। यूजुअली दे से एक और चीज सीखी 1A ऑटो एंटीबॉडी 1A all feature of type 1 diabetes but without auto antibody. But beta cell destruction has MODY में no insulin, no antibody, but beta cell are preserved. तीन चीजें next slide. हाँ कॉमन एसिड इन यूरोपियन कंट्रीज बता दो और इतना बड़ा क्लू दे दिया आपको अल्कोहल वेल बिल्कुल सही आता है कितने लोग ए वाले हैं बी वाले सी वाले डी वाले राइट आंसर ए है क्विकली लास्ट क्वेश्चन
ST elevation.
ST elevation, the right answer. 10 marks, next slide please. Tall T wave within few minutes. ST elevation 2 to 3 hours. T elevation 8 to 12 hours. Q wave after 1 to 2 years. ये clinical scenario है, ये question last है ना INICT का question है, it might come to you. Within few minutes होगा तो tall T wave. Next slide please. हाँ, next ये audience question है, audience question. Next slide. ये audience question quickly. एक audience question.
Weight loss, polyuria, and polypepsia are measured in
Well,
quantities.
I know. Audience. Weight loss. अच्छा audience कितने लोग A वाले हैं? हाथ में लड़के. B वाले, C वाले, D वाले. But the right answer is A.
Okay.
कितने लोगों ने सही किया? हाथ तो खेलो यार. A the most common wrong answer. D है, बिल्कुल ठीक बोला.
Okay, so we have one more diagram.
अभी कोई दिक्कत नहीं, एक और अपने आप सबने फिल्म आई थी मुन्ना भाई देखी नहीं? उठाते हैं आप उससे पूछते हैं भाई what did that do? संजय अपनी टाइम
Ready, sir.
ओके चलिए the time तो इनका था
Time कम है हमारे पास, but we need a question which can sort it out.
ओके तो क्वेश्चन तो डोंट वरी क्वेश्चन बड़े सारे हैं यार. ओके तीन देखें इसके लिए ओके एक एक glucagon is secreted by which cell in pancreas?
Alpha cell.
और delta cell secrete what?
Somatostatin.
Okay. एक और सवाल एक और retinoic acid vitamin D. Okay, एक और सवाल. What the most characteristic feature of L3A? Clinical finding. Clinical finding. DIC. In which obstetric condition DIC can occur? Operative. Amniotic fluid embolism. Very common. Anyway, amyloidosis. Okay. Right. Tell me any drug which structurally resembles like thiazide, but main action is peripheral blood irrigation. Indapamide. Side. अर्ली सिटोल, अर्ली डायस्टोल का ठीक है, लेट सिटोल, लेट डायस्टोल मैंने क्यों दे दिया? अब यहाँ पर नेगेटिव मार्किंग होगी. नहीं, यहाँ भी नेगेटिव मार्किंग है, तो बोलो. this stone. Ali died. So sorry. Ali died. Sleep on that. Ali died में ऐसे ठीक है. Right. चलो एक और सा नेक्स्ट क्वेश्चन. एक बंदे को माइटर सिनोसिस है तो ओपनिंग स्नैप आ रही है. He come to you after some time, opening snap guide हो गई. उसको उसकी पैथोलॉजी में क्या है? उसकी पैथोलॉजी में क्या है? While we get calcified, और एस्पन सॉफ्ट हो जाएगी और calcified. Radon ये क्या आ गया? Radon is produced from the uranium. और आपको जान के हैरानी होगी, यूरेनियम पूरी दुनिया में है, मिट्टी में है, बट बहुत ही मामूली अमाउंट में दैट कीप और प्रोड्यूस रेडॉन. जो बेसमेंट जहाँ पे हवा इकट्ठी होती है, जहाँ एयर वेंटिलेशन नहीं होता, वहाँ रेडॉन होती है. दैट सेकंड मोस्ट कॉमन कॉज ऑफ प्राइमरी लंग कैंसर इन द वर्ल्ड. Thank you very much for this, all of you.
Thank you so much, sir. Thank you so much, participants. We finally have our winners. The team SA Node, Shreya Singh and Anjali Agarwal, and the runner-up is Team 2. 2 degrees, Hassan Abdul Karim and Mohammad Usairam Khan. Let's have a big round of applause for all of them. Today's competition reminded us that medicine is not just about textbooks. It's about thinking fast, thinking right. Thank you so much, sir. Thank you so much. Sure. So, definitely click a group photo. Let's first felicitate you for the lecture, and then we'll distribute the prizes for the winners and runner-up. I request Dr. Ajoy Saha, sir.
Thank you very much.
Thank you so much, sir. Now we distribute the prizes. Team 1 should stay on the stage. I request Dr. Mukesh Bhatia, sir, to kindly give them the winner prize. Give a big round of applause for Team 1. They did an amazing job. SA Node, Shreya Singh and Anjali have done an amazing job by winning this competition.
तस्वीरें खिंचाना भी जरूरी है जिंदगी में है मेरे दोस्त, क्योंकि आईना
अभी वो फेलिसिटेशन होगा.
I call the runner-up team 2 degrees, Hassan Abdul Karim and Muhammad Usairam Khan. Let's give a big round of applause to both of them. Thank you so much, sir. Thank you so much, quizzers. Yeah.
कंटाळा आला
डीबी को वाइड करें डीबी को जाऊ दे नाही काय नाही जाऊ दे
हो डायरेक्ट नो वरती गेला
सोड सोड सोड
वाईडच होतं
सोड राईट
It is now my pleasure Miss Anushka Tandon to kindly take the stage. Anushka is a remarkable young innovator, a high school student and the founder of Sonic Serenity, an AI-powered music therapy web application designed to provide personalized and accessible mental wellness care. Today, she will be presenting an inspiring and futuristic topic, AI-powered personalized therapeutic music platform for mental well-being. She is certified in music wellness from Berklee College of Music and is a trained pianist, vocalist and composer. Please join me in welcoming Miss Anushka Tandon. Everybody pay attention. Miss Anushka Tandon is here. She is going to give the lecture. So let's listen to her and let's everyone give a big round of applause.
Okay, hi. So to begin with, I would want to introduce Sonic Serenity. The idea behind the app is that music therapy, while it is an established science and while a lot of people are utilizing music therapy, a big problem with the current solutions is that there is absolutely no personalization. That means that there is a static playlist that is playing, or the therapist has to manually alter the instruments and the tracks used. This is why when I did conduct a study, I found that there was a great need for personalizing and making music therapy far more accessible to patients to allow it to be more effective and inclusive, changing consumer moods and preferences. This led me to develop Sonic Serenity. So Sonic Serenity is basically an AI-powered music therapy system that allows for real-time adaptation, emotion detection, a therapist dashboard, and generative AI personalization. The idea behind Sonic Serenity is it's based on a custom CNN model. The CNN model identifies different emotion data sets, be it happiness, sadness, anger, or neutrality, and this allows continuous dynamic. On the left, you would have the emotion graph that shows how the emotions are changing over time, and on the right, you would have a frequency change graph that shows how the frequency of the audio is changing and adapting based on the music. So after conducting early pilot feedback, we received a number of suggested recommendations like a pausing feature or spatial audio, which we are incorporating. The main primary idea of Sonic Serenity is this. Here's the homepage that takes you to the different features it offers. The Our Approach tab showcases the different aspects of music therapy that we cover. So the Our Services tab identifies the three main services. The first one would be using the camera and the CNN model for the personalized emotional healing. The next would be the progress tracking graphs. And the third would be saving the graphs for therapist control. Over here, we can see how the therapist, in the therapist login, can access the data of all their patients and can observe how the progress tracking graphs are changing over time. The generative AI module is a new module that we recently added. So this Gen AI module allows you to communicate with a chatbot, and it accordingly, based on your preferences of instrument, on how you're feeling, it generates a 5-minute long module that you can put on repeat. So the primary idea behind Sonic Serenity, I would say the defining feature is the Gen AI module, because it is allowing for user inputs and prompt refinement on a regular and recurring basis. Ultimately, Sonic Serenity allows for music therapy to be more personalized and accessible, and yeah, it's available online.
So am I audible? Am I audible? So I was going to ask, well, sorry, I missed the initial part.
Yes.
So how can this app help in preparing the discharge summaries of patients for more than, who are held in the hospital for more than 45 days?
Sorry, could you repeat?
I was saying a lot of residents find it difficult to invest their important time in preparing the discharge summaries, transfer summaries, whenever the patient is transferred outside the hospital, all the paperwork basically. So how can we use this app, or basically if that is the case, so what will be your target audience, target patients?
So the target patients can be literally anyone to everyone, because music therapy is something that I can use, a patient can use, an elderly citizen can use, a kid can use. You need anyone sitting here who can utilize it.
Okay, so
To reduce stress and anxiety on a regular basis.
one last question.
Yes.
What is the time limit for discussion? Anyway, so do you feel it will be helpful for
Incorporated too. But yeah. Okay, thank you.
Thank you so much, Anushka. Thank you so much, Dr. Chinmay Akre sir and Dr. Akshay Yadav sir. Next, we start with our competitions. First, we'll go on with oration, then singing competition, and then poetry competition. May I know who all
inspiring segments of Youthcon 2026. Voice of the White Coat, the oration competition. The white coat is not just a uniform. It is a symbol of responsibility, compassion, and leadership. Today, our participants will not just speak, they will express the voice of medicine. To evaluate and guide this powerful platform of ideas, I now invite our esteemed judges to kindly take their seats. I invite Dr. Rajesh Dere Sir, Maharashtra State Chairman, IMA JDN, and Dr. So please come up on the stage. We call our first participant, Dr. Om Bhalerao, to express his views.
सर्वांना नमस्कार. मी डॉक्टर ओम भालेराव, जनरल सर्जरी रेसिडेंट, 3rd year, टोक्योला नॅशनल मेडिकल कॉलेज अँड नायर हॉस्पिटल, मुंबई. आज मी या डायसवर नीट पीजी, नीट यूजी आणि नीट एसएस आणि विद्यार्थ्यांमध्ये असलेला स्ट्रेस आणि अपेक्षित रिफॉर्म्स यावर मी बोलणार आहे. आज मी इथे सर्जन किंवा एक पोस्ट ग्रॅज्युएट स्टुडंट्स म्हणून उभा नाहीये. आज मी त्या लाखो नीट यूजी सर, आज आपण या सिस्टीम मध्ये जर बघितलंय तर विद्यार्थी हा नेहमी एक दुभाजिक विभागाचा पार्ट असल्यासारखं झालेलं आहे. आपण नेहमी पेशंटच्या बाबतीत सगळं बघतो, पेशंटचं नैराश्य.
Yes, it's questions if required.
Good evening to respected dignitaries on the dais and my dear friends. So the topic given to me is academics versus service, finding the right balance. So first let's clearly define the domains. So academics, Subhashri, yes. So good evening respected dignitaries on the dais, good evening friends. So the topic given to me.
Please, all candidates are requested once you are there. Organizers, you just count their 3 minutes after their introduction. Introduce yourself properly, name, what you are doing, which college, what is your topic, and in which language you are going to orate.
A very good evening to one and all gathered here. I am Dr. Subhashri S.
So any questions?
Now, what is your view of your topic? What is the better approach for any PG student or even MBBS student? Academic is in MBBS also.
Yes, sir.
And service you can do after MBBS also.
Yes.
So what would be your right approach after your thoughtful discussion or your oration? What do you feel the right approach has to be when you target a government service after your education and when you target your private practice after say you do PG or you do MBBS?
In COVID, we needed the academic part, we needed evidence to prepare vaccines and all. But end of the day, service is priority because medicine relates to humanity. So service is priority and service complemented by academics is always the best approach.
That means you end up with saying, out of these two, service should be priority.
Yes, sir. It is.
And it should be associated with
academic.
Does it hold good for this subject?
So in that case, serving the doctors will be the priority. Like going regularly and taking good academic sessions will strengthen the upcoming community so that they will have interest in the medical field and they will end up being sincere doctors in the future in whatever specialty they take up on. Thank you.
What will you do today,
If a man in the past is born again, then he would die of an instant shock, just because seeing the sheer, relentless exhaustion etched onto the faces of those stars.
Sir, do you have any questions for?
Sir, there are regulations, but functionally, when it comes to the performance, there are a lot of loopholes and gaps. Because we have seen, last year we have seen more than 50% of the doctors having burnout.
To provide the quality healthcare that we all strive to give. Those unneeded scans from the sheer dread, judgment fogs, bold decisions are traded for caution. Fear reshapes medicine, birthing defensive practices. This is why we turn to solutions with urgency. India saw a promise with the 2019 draft bill criminalizing violence against healthcare workers. Yet, it faltered, lacking central enforcement with the mere excuse that existing state laws and IPC provisions were sufficient. Private member bills still remain stalled in the parliament, leaving states fragmented and perpetrators emboldened. The hour demands an urgent legislation now. A comprehensive central law, police protection in every hospitals, bolster infrastructure with dedicated teams, CCTV protection.
Types of means, regulations we should take.
Yes.
But you see, whatever happens, whenever you have an assault, it's the fault of both sides. So as doctors, we have to think in our side only. We cannot expect the patients to react the way we react. So where do you think there is a lack of a certain type of attitude that we have, the way of treating? Because we can only change ourselves, we cannot change the public, right? So where do you think we definitely lack something, public lack also there. They've got grief, they've got frustration.
Betterment of the hospital environment. Of course, doctors are burdened with overworking, the long hours and overloaded work. So, reducing that part with better systems in the hospitals, we can.
Good evening, everyone. My name is Shraddha Sunil Kori, third year MBBS student from D.Y. Patil Medical College, Kolhapur. And now here I am to speak on the topic safety of women. It's not a right, it's a right, not a privilege. The violence among the doctors, especially the female doctors, is increasing day by day. And it's not just physical but also gender biased, which has been shown by the studies that 64% of the females are suffering from it. And again, an IMA study also says that 45% of the female doctors have the safety concerns at the night shift and lacking of proper duty rooms. Now the sexual harassment is also legal.
Respected judges, seniors, and my dear colleagues, I am Tejas from D.Y. Patil Medical College, Kolhapur. And now I want you all to imagine one scenario. Imagine it's midnight in the casualty. A patient is rushed in. He's breathless, anxious, holding on to hope. And in that critical moment, all the eyes are fixed on one person. That is the doctor. Because in such critical instants, the patient won't see our degrees, but the patient will see our integrity, our compassion, and our competence. And my dear friends, these values come from the three real pillars of medical practice: ethics, empathy, and excellence. First pillar is ethics. In today's medical world, which is full of corporate pressures and legal concerns, it is ethics that keeps the medical profession a noble profession. And we saw this courage, as Dr. APJ Abdul Kalam once said, excellence is a continuous process and not an accident. So, technology will evolve, treatments will advance, but the soul of medicine will always remain on these three timeless pillars: ethics, empathy, and excellence, which transform a doctor into a true healer. So, I will stop here with a quote by Maya Angelou. She quotes, "People will forget what you said, people will forget what you did, but people will never forget how you made them feel." Thank you, Jai Hind.
Thank you, Tejas. Sir, do you have any questions for him?
What was your topic?
Sir, my topic was ethics, empathy, and excellence, the three real pillars of medical practice. Ethics, empathy, and excellence, the real pillars of medical practice.
How these are interconnected in medical practices? Three components. What do you?
So the topic was really great. He spoke really well, but he broke the rule that it's not allowed to read while they speak the speech.
That you take a call organized. What rules are followed? Question?
He is not considered for the position.
Ladies, this.
Yeah, you can have a question.
We are discussing as an academic platform.
Yeah.
You may disqualify as per your rules.
Okay, sir.
We don't matter also. Yeah, this is an academic discussion.
Connected, because sir, when we have a good ethics, we will have empathy for the patients, and when we have empathy, we will excel in our practice. Thank you.
1 minute, don't go. You spoke well. Now, according to the rules and regulation, whatever it is, your presentation was also good. So the result might be different. And I like the way you said it. You are very, very, very presentable and you got the points right. And that is the way actually we should approach a patient, the way he said it. Thank you.
Thank you, sir. True, sir. He spoke with clarity of intellect and emotions. Thank you, Tejas.
We often forget. But good intentions are not enough. We need concrete systems, autonomous independent counseling systems, welfare programs, stress management programs, peer connect, buddy systems. We need to create safe spaces where asking for help is not considered as weakness. Today, I'm not speaking as a medical student. I'm speaking as a voice of intern who cried in the washroom after every bad case, for every postgraduate resident who has not slept properly in the months, for every doctor who is trapped behind the race of success. If we want a healthier India, we must start by healing our healers. And this makes me come back to my previous question which I asked. If a doctor says, I'm not okay, who listens?
It was an excellent articulation and strong stage presence. Sir, do you have any questions for him?
See now, undoubtedly, all the state governments, Government of India has agreed for mental health in medical profession because of stress. But what do you feel can be a solution? You are from Grand Medical College, right? Overload of patient will be always there in every government institute. It may be civil hospital, THO, SDH or medical colleges. Now, how do you, your opinion as a presenter, what would be your opinion that is there any way out so that work continues and mental health is also taken care, may not be complete, but appropriately, which is required for each and every doctor?
Sir, as you said, it's true, like we can't lower down the overload. And what I think is every person has his own mental power to handle situations. Everyone can't handle that much pressure. And I think in this particular thing, as we medical students or we as residents or we as doctors should look after our colleagues. We should look, everyone is burdened by the same amount of work. Some might be burdened with a more amount of work. I think we should be very vigilant. We should see if anyone is there who is showing some kinds of like depression or anxiety or something which is diverting. We should be the first one.
My I think analysis was, how do you prevent all this? Is there any way out to prevent this? Treatment is a different thing.
That's
identification of the case, treatment from a psychiatrist, counselor will be after when he suffers from mental health issues. My question was, how do you have any solution to continue same workload with preventing mental health issues too?
Everyone, once you come up on the stage, announce your name, your college. That won't be considered in the time. And the topic too.
Respected judges, faculty and future healers. Good evening, I'm Shreya Singh, a final year MBBS student, and the question before us today is, medical education reforms in India, are we preparing doctors for tomorrow? So, on one hand, we have gained access. We have crossed 1 lakh MBBS seats. This is historic. This is triumph of quantity. But medicine is not about quantity. It's about competency. And the competency-based medical education, CBME, was meant to fix this.
Okay, you just had a discussion on AI in relation with this. Now, can AI create empathy while practicing?
Sir, I don't feel AI can feel human feelings. Like this is what I said. AI can retrieve certain data in seconds.
Only data. I think AI in healthcare आज topic था.
Definitely, sir. Definitely.
It is more than retrieving the data now. AI.
So definitely, but as far talking about the advancements that have happened, as far as I know, AI cannot empathize or like feel the human emotions. It cannot feel ki while a human is smiling, he is hiding that pain inside him or her. So I think AI has not yet developed. I certainly don't know about the future. If we can create robots with feelings and heart, I really don't know that. But for now, I feel AI can still not empathize and sympathize with the patients that humans can do.
You know, there are cameras in classroom now yet.
Yes.
It does not show vibrantly. It whispers. It whispers during those ward rounds. It whispers in the OTs. It whispers, you are not ready. And the worst part, doctors are trained for years to diagnose all kinds of pain except their own. And this is not an individual failing. You simply cannot inspire your way out of structural neglect. You cannot motivational speech your way out of a chronic exhaustion. Something that is long-standing. Empathy, compassion, all of these are factors which can never be replaced. Rest is not an indulgence. Mental health is not fragility. Setting boundaries is not something which is weakness. A system that burns its healers today will one day look around and find no one left to heal with. Thank you.
Excellent articulation and strong stage presence. Sir, do you have any questions for him?
You talked about burnouts.
Yes, sir.
What would be your solution to it? You got it?
Yes, sir.
This thing is, it's an unfortunate thing.
It is.
And we really don't want it to go ahead. So, according to you, how do we get out of it, or how do we reduce it?
Thank you so much for your question, sir. So first, I would like to point out the IMA has recently started a D4D program, which is a Doctors for Doctors. This has been a step towards ensuring that doctors have a safe space. They can talk about it, they can relax. So that helps the mental health aspects. We have doctors in distress in the UK. Sorry for the audience too. We have all of these scenarios which are prevalent. Secondly, what we have studied in community medicine, all of us, is that every PHC or every CHC, they have a minimum requirement. You need one doctor, minimum one. You know, they've got different in terms of ASHA workers, Anganwadi workers, all of these scenarios, along with the medical profession. That would be what I would try.
When I opt for government services, I know the workload will be there.
Scenarios, that is what has led us to get to the level we are right now, right, sir? But then after a point of time, everything saturates, sir. Stamina can get you to one level, but then we need to ensure that the plateau phase is not formed. This is what we want. When we start these, when we help the doctors have a safe space, we can go further, we can extend our... That is what I'm trying to tell you, sir. Your exact point. We want to go beyond, above, and the army analogy, sir, a doctor has to heal other patients at the end of the day. Yeah.
Example I give. I'm not comparing doctor services.
But yes, that was the saturation is what we have achieved as at this point of time, and that should not be existing.
Thank you.
Thank you, sir.
Thank you, Anand.
Part of a routine. A single sentence. That's all it takes to undo years of silence clinics. Once, the doctor's words was the diagnosis. Today, it competes with buzzing notifications, viral reels, WhatsApp messages, and prediction platforms and narratives, often created by people with confidence and not credentials. Back in 2009, Chimananda Ngozi Adichie warned us about the dangers of a single story. How repetition can distort trust and erase complexity. Medicine today faces a paradoxical twist of that warning. We are no longer trapped by a single story, but overwhelmed by too many unchecked ones. Fragmented, emotional, and amplified by the algorithm rather than evidence. social media has undeniably empowered patients. During COVID-19, people recognized symptoms before ambulances could arrive because information spread faster than post. Thank you, sir.
I think doctor-patient relationship was your topic. Acha, with special reference to sir. You talked about okay in the social media.
Shruti Lavate. Next we call Dr. Rehan Hussain. Okay, so since they are not present here, we can announce the winners and the runner-up.
Give us some time, because there are
Okay,
a bit of a tie and there's like another. Actually, this lady, who's Disha, right? The one who spoke at the end.
Yeah.
Disha. What you? No.
So they are here.
Huh?
They are here. Come. So they are here.
Huh?
They are here. Come.
Just made it.
I invite Akanksha Mohanty to come up on the stage.
Good evening, respected judges and my dear friends. I'm so sorry for the delay.
It's okay.
Alright. In India...
First introduce yourself, your college, and then we start a time.
Alright. So hi everyone, my name is Akanksha Mohanty. I'm a third year medical student from Mahatma Gandhi Institute of Medical Sciences, Sevagram. Alright. So in India, when we go to a government hospital, a rural patient never asks, doctor, which pathy do you practice? But rather, doctor, will I be safe? Today we are here to discuss mixopathy, a term policymakers don't even think is real, but rather just a coined term. But when it's sick in real life, because biology acts immediately. As Dr. J.A. Jayalal, the past president of Indian Medical Association, very rightly said, our fight against mixopathy is democratic. It's not against traditions or heritage or practitioners even. It's against the quiet.
Your topic was related to mixopathy.
Yes, sir.
So, I think you ended up with saying that mixopathy will endanger the life of the patient, if
Yes,
I'm not wrong.
Yes, sir.
The analysis is this.
Yes, sir.
But, what NMC in this matter has discussed, and there are various research papers in few diseases, chronic diseases, it has been established that integrated practice, I am not talking mixopathy, integrated practice of allopathy, Ayurvedic, homeopathic or Unani can be a good savior for certain.
Thank you, Akanksha. Okay, next we call Mahi Verma on the stage.
Good evening, respected judges and my dear colleagues. Yes. Stipend policy for medical training.
Bad extent.
Okay.
Yeah, I think it's not bad. But you are talking of stipend. What do you mean by stipend? Is it a salary?
No, it is a certain fixed amount that...
Why stipend is given? Do you know what is the basis of starting a stipend while learning your degrees? It is only for sustainability of the student when he is getting himself or herself educated after completing graduation. So means my personal opinion.
Medicine is not only practiced with hands, but also with voice and vision. Judges will now take a few moments to finalize their decisions. Until then, I invite Dr. Abul Hassan sir to kindly come up on the stage and brief on the topic he wants to cover.
Good evening all. All are so tired. Just give me a minute. I just want to present you a path-breaking initiative from IMA for the sake of exclusively for the sake of young doctors of India. Morning I spoke in my talk, Entrepreneurship in Medical Profession, about this initiative, along with all group, Indranil, Akshay. And because we have been talking about this particular, what is this initiative? It is a Job Opportunities and Career Facilitation Bureau from IMA for the sake of young doctors. This was initiated because we are producing more doctors. Some metros there are more number of doctors, some areas there are less number of doctors. There is no equal distribution of doctors. And also there is a congestion. Right? Congestion happening in our country with regards to jobs for MBBS doctors, right? And there are situations you might have had, though rare, that our doctors opting for some other profession after MBBS, right? So, out of all these problems, we wanted to maintain the dignity and honor of young doctors in this country, right? What I mean is, their remuneration should not be low, right? They should not opt for a low-paid jobs for the sake of numbers, for the sake of the easily available number of young doctors in our country. So what we have done in this is a job portal. It is an IMA Employment and Career Facilitation Bureau. Right? So I request all of you, every one of you, just click this website, www.imacareerfordoctors.com, immediately.
Everybody, take your devices in your hand and search this.
Immediately you go there, you see there are two verticals. One is employees vertical, another is employers. Right? Employees are meant for junior doctors. Registering this portal is completely free for all the doctors. The employers, that is hospital owners, would have to pay some amount and register this. Right vertical, where we want to go for higher studies. In those countries, their vacancies in universities, their universities also will be available. So, as a promotion thing, we wanted to, actually, this would have been done in the morning so that many people might have entered. So we want to do promotion. So from today, whoever is registering this thing will be will be waiting till 100 registrations. Once 100 registrations are completed, we will be giving cash prize for 2 registrations, right? So tell your friends immediately, share this, and because the hospitals will be happier to see many employees are registering this portal. There is a reason we are keeping, there is a reason we are pushing this among young doctors. Otherwise they will stop seeing.
That what I teach, what is my topic, and what better the frontiers In classroom they are students, here they are delegates. I can convince them for my topic. That would be 70 to 80% of your component, and 10 to 20% of component would be replying to the judges like us with proper analysis on your topic. See, any topic without critical analysis known to that speaker, ये ऐसा है कि मैंने इंजेक्शन बुक में पढ़ा 45 डिग्री एंगल देना है 26, बट इंजेक्शन देना ही नहीं आया बाद में. So that should not be the effect. So you are in young budding stage, a way long to go. Whenever you present in any platform, always take this at a point. Your topic should be precise. To see how can he teach to his students, how can he connect with the masses. Just like you can be one of the leader in your future. It's not कि मैंने डॉक्टर हुआ है तो मैं जिंदगी भर प्रैक्टिस ही करूँगा. No, you can become a good MLA, corporator, minister, chief minister, even prime minister also. So thank you very much. You have done a very good job at this age, and I hope day by day you grow for betterment of yourself. Just that hair's breadth extra, somebody got. Of course, you'll come to know who that somebody is. So the runners-up, okay, is Disha Kharde and Anvat Chawla. You got the big one. You just couldn't make the difference between these two, so we said we'll give it to both of them. Will the prize be given? Okay. Tell the winners also. Achha. Now, winner is, any guess? No, it's okay. I won't ask questions. You have been already asked questions in the last session. Akanksha Mohanty. And a special mention for really coming very, very, very close is Subhashri Singhal. Give her a big hand. She's not getting a prize, but well, you've done very well.
I request Dr. Ajoy Saha sir and Dr. Rajesh Dere sir to kindly felicitate the runner-up, Disha Kharade and Anhat Chawla. Let's give a big round of applause for both of them. All the winners and participants will get their certificates, so don't forget to collect it. Our first participant, Akanksha Mohanty.
Thank you.
Wonderful performance, Akanksha.
जो मुझे आवेला सपने हुए सरफिरे वे हुए सरफिरे हाथों में आते नहीं उड़ते हैं लम्हे मेरी हंसी तुझसे मेरी जिस दिन तुझको ना देखूं
Until we announce the name of the winner for Source and Junior competition, let me check if everyone is present for the next competition we are going to move forward with. Dr. Gopika, Brinda Sharma. Brinda, are you here? Rudra Verma, Akanksha Mohanty, Mahi Verma, Arpita Atwal, Shreya Singh, Supriya A, Apurva M, Tejas Kadam.
And we didn't want to have another tiebreaker. That was the main thing. So when I say both were good, but it was almost like a tie. But then instead of going for a tiebreaker, we said, okay, let's go by the feeling. So you kept everybody bouncing. She tried to make everybody emotional. So we went for the emotional. Alright? Congratulations.
Invite Dr. Indral Deshmukh sir to kindly felicitate Dr. Ajay Saha sir and Chinmay Sahu sir. So please come up on the stage. We now move to Kavita Capsule, where poetry becomes the heartbeat of expression. Poetry allows the white coat to speak its emotion.
Universal freedom is eternal and infinite bliss. We should all therefore be able to realize this. Thank you.
Thank you, Shreya. Next we call Riya Vaduachi on the stage.
Good evening, everyone, respected judges and the respected delegates over here. So, on this auspicious stage in front of our doctors, I would like to dictate a self-written piece of poetry.
Famous poem by Rudyard Kipling named as If. So it is basically a conversation between father and self. Have confidence. Don't confuse it with arrogance. Accept with grace both critic and compliment. My dove, you love your solitude. Still celebrate loved ones with gratitude. Be cordial to all and laugh with many. But choosing trusted people, always be canny. When the need arises, raise your voice. It's very different from making noise.
your tone in control, and softness in voice. Sometimes keeping quiet is the best choice. My precious princess you've always been. Walk off your comfort and become a queen. This dynamic balance, the day you learn, you will be a lady, my little girl. Thank you so much.
Let's continue with the Kavita capsule competition. I invite Mahi Verma on the stage.
Good evening everybody. My name is Mahi Verma and I am presenting a poem titled Beginner's Guide to Being Human, which I wrote myself. It's my first time living life too. Tell me, does it ever feel that way to you? Do you stumble and fumble, unsure where to go, while others seem to glide like they already know? Like they already know what they're doing somehow, where they're headed, where they're now. And yet, there are some people who seem to live life as it is, already said yes to them, while we keep asking ourselves again and again, is this really the right way? Do you ever stop and ask yourself why? Why so? Thank you.
Next I call Dr. Gopika on the stage.
Namaste everyone, this is seniors and delegates. Today I am standing before you to draw your attention towards my poem, Homesis. Yet the gazes and faces never entered the language of hospitals. They enter not for their wound, but for the fever of their cattle. On the way to a stream a day, saw an emaciated baby owning a monkey face, with brittle hair and dry eyes. A little old man he is, holding marasmus. On hospital corridor someday, saw a man resembling lion by way, thickened face, no eyebrows. At daybreak, a merry kid ran to me, flat face, I looked closer, small chin and slanted eyes, a soul with dawns. Wish to portray all the faces, achingly beautiful faces, keeping it brief but vast enough to wound. Expressions that carry local winds in their lungs, in the grammar of very dust. Thank you.
Thank you, Dr. Gopika. Next we call Meghna Dade on the stage.
जाता है अब एमबीबीएस शुरू हो जाता है और अचानक से फाइनल ईयर में याद आता है कि नीट पीजी भी बाकी है, तो अभी बाकी है पे कुछ लिखा है कि इस दुनिया पर
Meghna. Next we call Arpit Atwal on the stage.
Good evening everyone, I am Arpit Atwal, first year medical student from ESIC Mumbai. I have written many poems, but this poem is quite simplistic and it is my mother's favorite poem written by me. इस कविता का जो शब्दावली है सो बहुत सरल है, ये कविता बहुत सरल है, इस कविता का जो छंद है सो बहुत सरल है, परंतु जो सरल नहीं है सो है उस कविता का भाव। कविता जरा लंबी है, एक दास्तां है, मेरे साथ बने रहिएगा। कविता का नाम है क्या वो तुझे मुझसे ज्यादा प्यार करती थी। आओ बैठो मेरे संग, तुम्हें सुनाऊं मैं अपनी कहानी। रुक बैठ जरा, सुनो ये मेरी दास्तां पुरानी। इकलौता था अपनी माँ का। मुझे खूब लाड़ में रखती थी, हर वक्त रहती थी उसे चिंता मेरी सेवा करना थकती थी। पिता से तो नहीं बोलता था ज्यादा, माँ था जवान मैं और था सुंदर, मुझसे माँ का कोई ना भाता था। जवानी का जोश था ऐसा, मानो मुझे अपने बाप से ज्यादा आता था जवान मैं और था सुंदर, एक लड़की मुझे खूब भा गई। हुए कुछ ड्रामे कई चोचले, पर आखिरकार मेरी बाहों में आ गई। मेरी बाहों में होती थी वो, मुझे जीवन ये जन्नत लगता था। मेरे ख्यालों में रहती थी वो, हर पल एक सपना सुहाना। क्या कमी थी। फिर एक दिन जहां अभी हो तुम, मैंने अपना फैसला मकबूल किया। पंखे पर माँ की चुन्नी बांधे और उस सूली पर झूल दिया। पहली बार रोता देखा अपने बाप को, पता नहीं था अकेले में मुझसे प्यार करता था। मेरे मरे शरीर को चूमता, छाती से लगा दुलार वो करता था। मेरी माँ बेहोश हो गई, मेरे जलने तक सिसकियां न रुकती थी। मेरी माँ बेहोश हो गई, मेरे जलने तक सिसकियां न रुकती थी। बुढ़ापा छा गया उसकी व्यथा मेरे रूह को दुखती थी। जिसके लिए मरा था वो मेरी मैयत पे झांकने भी ना आई। मैं तो बीता अतीत था उसका, कर ली किसी दूजे से सगाई। बया गई वो किसी और से, किसी दूजे के संग हुए अपने बच्चों का पलना करती थी। माँ रोती रही जिंदगी भर पूछती, क्या वो तुझे मुझसे ज्यादा प्यार करती थी? कहता हूँ दोस्त, काश जी लेता मैं कुछ और दिन। मेरे जाने पर मेरी माँ हर पल मरती थी। हर वक्त उसे कहना चाहता हूँ, नहीं माँ, तुझसा मुझे कोई प्यार नहीं करती थी, तुझसा मुझे कोई प्यार नहीं करती थी। थैंक यू सो मच।
Thank you, Arvind, for such an incredible performance. Next we call Supriya A on the stage.
Good evening, everyone. I'm Dr. Supriya Avargan from Holy Spirit Hospital, Mumbai. So I'm presenting a different kind of love story in Marathi language. तर कथा आहे एक नदी आणि पाण्याची. नदीच्या काठावरती उभं होतं एक झाड. नदीच्या काठावरती एक उभं होतं झाड. पाणी देऊन नदी ज्याचे करीत होती लाड. नदीच्या काठावरती उभं होतं एक झाड. पाणी देऊन नदी ज्याचे करीत होती लाड. डेरेदार झाडावरती एक इवलस पान. डेरेदार झाडावरती एक इवलस पान. जीव ज्याने ठेवला होता नदीसाठी गहाण. पान नदीमध्ये त्याचं प्रतिबिंब पाहायचं. पान नदीमध्ये त्याचं प्रतिबिंब पाहायचं. नेम नव्हता नदीला, तिला मात्र फक्त होतं वाहायचं. नेम नव्हता नदीला, आता सजा वाटत होती. पूर्वीची मौज पानाला आता सजा वाटत होती. नदी सुद्धा हळूहळू आतल्यात आटत होती. नदी सुद्धा हळूहळू आतल्यात आटत होती. पाण्याला आता प्रवाह विरुद्ध पोहायचं होतं. पाण्याला आता प्रवाह विरुद्ध पोहायचं होतं. पण नदीला तर बस आयुष्यभर वाहायचं होतं. नदीला तर बस आयुष्यभर वाहायचं होतं. एका वळणावर तिने पाण्याला पात्राबाहेर लोटलं. एका वळणावर तिने पाण्याला पात्राबाहेर लोटलं आणि पुढे जाऊन नदीचंही सारं पाणी आटलं. पुढे जाऊन नदीचंही सारं पाणी आटलं. मरता मरता पान शेवटी स्वतःशीच बोलून घेतो. आणि मरता मरता पान शेवटी स्वतःशीच बोलून घेतो. आपण नदीपासून थोडे दूरच बरे होतो. थँक्यू.
Thank you so much. Next we call Dr. IMA on the stage.
Good evening, everybody. My name is Himaja. Today I stand before you to present a small poem which I wrote by myself during my residency, where there was no joy found in my residency, and I started searching them in small things. In halls that hum with beeping tones,
I often feel I'm skin and bones. The shift is long, the night is deep. Yet in small joys, my soul does keep. A warm sip of chai at 4 a.m. A nod from staff, no need to name. A patient smile, a calm extubate. These little things.
हम अक्सर जिंदगी जीते तो है मगर उसको महसूस करना हम भूल जाते हैं और शायद जिंदा रहना भी सिर्फ सांस लेना नहीं है बल्कि अपने डर के बावजूद हम आगे बढ़ना चाहते हैं। नमस्कार, मेरा नाम है अपूर्वा मुखर्जी और मैं आपके सामने आज एक ऐसी कविता प्रस्तुत करना चाहती हूँ जो कि इसी भावना को शब्द देती है। फरहान अख्तर द्वारा रचित एवं प्रस्तुत तो जिंदा हो, दिलों में बेताबियां लेके चल रहे हो तो जिंदा हो, नजर में ख्वाबों की बिजलियां लेके चल रहे हो तो जिंदा हो, हवा के झोंकों के जैसे आजाद रहना सीखो, तुम एक दरिया के जैसे लहरों में बहना सीखो, हर एक लम्हे से तुम मिलो खोली अपनी बाहें, हर एक पल एक नया समा देखे ये निगाहें, जो अपनी आंखों में हैरानियां लेके चल रहे हो तो जिंदा हो, दिलों में अपनी बेताबियां लेके चल रहे हो तो जिंदा हो। एक बात होठों तक है जो आई नहीं, बस होठों तक आ जाए वो आवाज की बाहों में बाहें डाल के इठलाए वो, लेकिन है हर पल एक नया मौसम। क्यों तू ऐसे पल खोता है दिल, आखिर तू क्यों रोता है, आखिर तू क्यों रोता है, आखिर तू क्यों रोता है।
Thank you so much, Apurva. Next we call Tejas Kadam on the stage.
आणि उपस्थित श्रोते, मी तेजस कदम, डी.वाय. पाटील मेडिकल कॉलेजचा विद्यार्थी आज छत्रपती शिवाजी महाराज यांच्या जयंतीनिमित्त एक कविता सादर करणार आहे, ज्या कवितेमध्ये कारभारणीला घेऊन संगे सर आता लढतो आहे, पडकी भिंत बांधतो आहे, चिखलगाळ काढतो आहे, पडकी भिंत बांधतो आहे, चिखलगाळ काढतो आहे, खिशाकडे हात जाताच हसत हसत उठला, खिशाकडे हात जाताच हसत हसत उठला, पैसे नकोत सर, पैसे नकोत सर, जरा एकटेपणा वाटला, मोडून पडला संसार तरी मोडला नाही कणा, मोडून पडला संसार तरी मोडला नाही कणा, पाठीवरती हात ठेवून फक्त लढ म्हणा, पाठीवरती हात ठेवून फक्त लढ म्हणा. धन्यवाद. जय हिंद, जय शिवराय.
Thank you so much, Tejas, for such a wonderful performance. Judges will take a few moments to announce the winner. Until then, I invite the scientific committee team to announce the winners of poster and paper presentation.
In today's fast-moving world of medicine, where new data emerges every day, it is evidence-based practice that keeps us grounded. Scientific rigor is not. This conclave is a reminder that research begins with curiosity, grows with discipline, and changes lives with evidence. We had a very amazing. So the best poster winners are Archit Pingle, plastic surgeries, and Dr. Anushka Malu for anesthetic management for MRI in pediatric patient with Treacher-Collins syndrome, anticipated difficult airway. So Anushka Malu for anesthetic management for MRI in pediatric patient with Treacher-Collins syndrome, anticipated difficult airway. So congratulations to both the winners. Your certificates and awards are with us. Kindly connect with from us. And
for the first session, we have Dr. Milind Sawar, whose paper Trends in Birth Outcomes and Child Immunization Coverage in Palghar District, Maharashtra, a secondary data analysis. And for the second session is Akanksha Mohanty for Knowledge, Attitude and Practices Related to Menopause Among Perimenopausal Women in Rural Central India, a community-based cross-sectional study. We congratulate the winners for their excellent performance and presentation, and we request you all to collect your certificates and trophies from us.
Again, we are in a dilemma. We have got 3 people who are equally good. So now we have to really see the other paraphernalia of poetry recitation. And on that basis, we have one person who is first, and we have got 2 runners-up. The runners-up are Arpit Atwa and Meghna Date. Both I think spoke on Hindi, right? In Hindi, right? And the winner, Apurva M. M for what? Mukherjee, Bangani. Come, you are the winner. And the runners-up.
Now we call the runner-up Meghna Date and Arpit Atwal. Next we announce the winner, Dr. Apurva M. Miss Apurva M. Just come on the stage. To all the participants of Kavita Capsule Competition, everybody's performance was amazing. Everyone did a great job. A big round of applause for each one of you. It requires immense courage to come up on the stage and speak, and that to a poem, that's another level. Everyone, do collect their participation certificates. As we approach the conclusion of this enriching and memorable day, we now move towards the valedictory ceremony. Every successful event deserves a meaningful reflection, and every journey deserves a graceful closure. I now invite IMA Maharashtra convener Parth Panase, IMA Maharashtra MSN convener Parth Panase to take up Parth Panase to take up the stage and now carry forward this wonderful session.
Good evening, everyone. I request Dr. Ajoy Saha sir to join us on the stage, please. we'll be continuing with the valedictory ceremony and give the organizing team their mementos and certificates of felicitation. I request Prajakta Kute, Joint Secretary MSN, to kindly step up and collect the honors. I request Dr. Akshay Yadav sir to please join us on the stage. I request sir to felicitate Dr. Indraneel Deshmukh sir, organizing co-chairperson. Hello. Yeah. I request sir to please felicitate Dr. Akshay Yadav sir, organizing co-chairperson. I request Dr. Tithi Banerjee ma'am, organizing secretary, please join us on the stage. I request Dr. Kanhaiya Kumar sir to please join us on the stage. He's Additional Organizing Secretary for Youthcon. Hello. I request Dr. Samriddhi Penke ma'am, please join us on the stage. She was the lead team member for registrations. I request Dr. Pooja Dongre ma'am, please join us on the stage. Lead social media team. I request Dr. Advait Mastood sir to please join us on stage, event team lead. I request Mohit Jadhav to please join us on the stage, lead sponsorship and logistics team. I request Dr. Angel Ma'am, lead workshop team, to please join us on the stage. I request Dr. Aditi Pandey Ma'am, lead scientific team, to please join us on the stage. I request Sushmit More to please step up, lead design team.
So all the flex, all the banner you are seeing is designed by him only. Big round of applause for him.
I now request members of the event team, Hussain Ansari, to please step up on the stage. I now request the members of the design team, Dinesh Chauhan, please step up on the stage. I now request the member of the design team, Shehzad Khan, please step up on the stage. I now request Natanshi Kumar, member of the sponsorship and logistic teams, please join us on the stage. I now request Meghna Date, member of the workshop team, please join us on the stage. I now request, last but not the least, the member of a scientific review team, Akash Randive, please join us. We also had the contribution of Dhruva Deshpande, who is not currently present, but we value it. Thank you. Oh yes, Samriddhi Kankaria, who left shortly, has also contributed greatly to Youthcon 2025. I request Titi Banerjee ma'am to kindly say a few words.
So I know it's too late, but before we conclude, I just want to say a big round of applause for my team. They have worked so hard in last few months because without them this event won't be possible to happen, and they are the students and the interns who were doing 24-hour and 36-hour shift. Despite of that, they have managed all this thing. So without them, it won't be possible at all. So big round of applause and clap yourself for. You have done a great job. All my bachus, I want to take their name again. Samriddhi, Angel, Aditi, Pooja, Shushmit, Dinesh, Saza, Meghna, Samriddhi too. And Mohit, Natamshi, और किसका मिस गया? Advait, obviously the face of the day. And सबका हो गया ना? And obviously one name, without that name, this event won't be possible. Dr. Indralin Deshmukh. He was the initiator of this event. So big round of applause for him, sir. Thank you so much for the effort. Without him, this event won't be possible. And Dr. Akshay Yadav, sir. हाँ, party तो लेंगे अभी. And my partner of crime, the GS and the additional secretary, Dr. Kanhaiya Kumar.
Next, conclave like same, and we will definitely do everything. Thank you so much, everyone.
I want to invite one special person, Dr. Pratiksha. Please come on stage. She was not in the organizing team, but she has volunteered and helped us the entire day. So thank you so much. Please come on stage. Yeah. I want Dr. Kanhaiya to felicitate us. Thank you so much for volunteering us. She has helped a lot.
Hello. I request Dr. Ajoy Saha sir, Indranil sir and Akshay Yadav sir to please join the stage for the last batch of certificate distribution. I request Dr. Samriddhi Penke to honor with a certificate of honor for her serving with sincere efforts and consistent dedication as the President of College Council of GMC Mumbai, IMA JDN Maharashtra. I request Dr. Advait Mastood and present him with a certificate of honor for his sincere.
Without your presence and without your help, this event won't be possible. Thank you so much for coming and helping us.
Yes, ma'am. Ma'am, you shout out to Kriti ma'am as well. Yes.
मैंने तो खालच्या एक लाईन इकडे घ्या ना तर वरची लाईन तिकडे घ्या लेवल करा नाही तर एकाला खाली घ्या कोणाला पण तू काय एवढं लपतोय
चालेल ना
And thank you so much for watching us, tolerating us. Those who are watching online.
Thank you, sir. Thank you, ma'am.
Goodbye.